Good afternoon and welcome to the Hillsborough County Emergency Policy Group meeting. Hope everyone had a great weekend and all fathers had a great Father's Day. Will the clerk please call the roll?
Good afternoon, board members. Miller?
Here.
Overman?
Here.
Merman?
Here.
Cronister? Cronister?
Here.
Castor?
Here.
Ross?
Here.
Lott?
Here.
Snively?
Here.
And Merrill.
Here.
Thank you. You have a quorum.
Thank you very much. We're now moving to public comment section of our agenda. We're allotted 20 minutes total for public comment. Each speaker will have 2 minutes to speak. Our first speaker is Colin Gow.
Colin dropped off, sir.
Dropped off, okay. Next is Luke Chachito.
Yes, I am here. Thank you for having me in this conversation. My background pertaining to the wellness, I have a business I've owned and run here now for 7 years. I live in Hillsborough County. I have 3 children and a wife, and my concerns are where I feel like there has been a lot of words to wearing a mask. Mine happens to go the opposing way of not wearing a mask. Due to the circumstances being in the field for almost 20 years now, my profession in the wellness, I've worked with major league athletes, was working with Texas Rangers. I worked here locally with the Tampa Bay Buccaneers, and I've worked in clinics. And my perspective on wellness is to try to promote well-being for each individual that I help. And with that being said, I've followed the narratives of what's being said in the public eye, and I wanted to bring some of my thoughts to the members and as well as to Hillsborough County. Some of which that I don't think are being talked upon. I don't know that so many people we know how many times you touch your face, if that was even something that was brought up. But on average, I can give you all the citations at the end, because I only have 2 minutes to speak. 43 times on average that somebody touches their face throughout the day is quite a bit substantial. Masks, only one that really is showing that to be proven to be a benefit is an N95. That comes with a lot of health risks that I find could hit the public hard from a sickness that if the city is willing to, in malpractice, when you talk to doctors, they talk about malpractice all the time. If we're going to prescribe a mask, we better be willing to take the hit if a lawsuit comes from somebody with COPD or somebody who's going to block their airwaves. Second to that is that when you look at all the research of hypoxia and the implications that come with wearing, it can be very
Sir, your 2 minutes are up. Thank you very much. Thank you. Kevin O'Neill.
Yes, Chairman, thanks for calling. Yes, Chairman, thanks for calling on me. Hello, mayors, council members, commission members. This is Kevin O'Neill speaking on behalf of the Hillsborough Libertarians. As you know, it's the first time in world history we are quarantined healthy people at the state level. This is unprecedented. There's no data to support doing such an act before, to support doing a mass quarantining. And with that in mind, you guys are still collecting tangible personal property tax on all of our businesses. We have approximately 41,000 businesses in Hillsborough County, of which the Small Business Administration in Washington, D.C. designates about 72% of the businesses in Hillsborough County are in fact small businesses under their guidelines. I'm here to request, and I am working, our group is working the entire county, all 3 municipalities, that we do a motion at your local government levels and of course at the county level to prorate back to the business owners these now 16 weeks of tangible personal property taxes before the bill goes out in January. We're interested in doing what's fair. This has been an extraordinarily high expense for business owners. We'll be lucky if we don't lose 20% of our small businesses countywide. This is in fact a result of government coming out with edicts to fix all things, like across the board edicts is just outrageous. This could have been handled several different ways. Number one on our list would be voluntary. You guys could spend all the time and money on marketing instead of forced quarantining. Marketing would have gone a lot further to educate the populace, and we'll be happy to work with any of you guys at your commission or committee levels to work out the language and see if we can get something done positive for the people and the businesses of Hillsborough County so we can keep this economy rolling forward. If you want the details, you can find it on our social media.
Mr. O'Neill, your time is up. Thank you very much, sir. Thank you. Janet Nguyen.
Hi, this is Janet Nguyen with the Tampa Bay Young Republicans. I'm here today to ask you to repeal the mask ordinance passed last week. Today, not only am I making a statement representing the young Republicans of Tampa Bay, but also many, many of our constituents who have contacted us to thank us for speaking out against the unconstitutional ordinance that was passed last week. Of course, as testing increases, so will the number of positive tests. However, I never hear anyone talk about how 114 people in Hillsborough County have died of COVID. That's approximately 0.007% of the county. Our sheriff himself has stated this ordinance would be very difficult to police. There's little to no research that shows that masks stop the spread of the virus. Yes, you can Google and find articles with opinions of people who think masks help. However, reliable data of multiple studies does not exist. The spread of the virus in countries that did or did not mandate masks since March is similar. It's incredibly insulting to be told I don't have the ability to take care of my own health, and this ordinance violates the state constitution in many ways. The ordinance needs to be explicitly defined, and this is not done with the vague language that was put in place. There's also an equal protection issue here. You can't treat similar people in different groups differently without a rational basis, and the 6-foot rule gives businesses the right to choose or not choose to enforce the mandate. There are also Florida privacy laws that are violated. We have the right to bodily autonomy, and when you mandate masks and someone has to explain why they may not be medically able to wear one, you're violating the Constitution again. These are just 3 examples of violating the Constitution, and I could go on, but you get my point. Please stop violating our rights and repeal the mask mandate. Thank you for your time.
Craig Reynolds.
Hi, Mr. Chairman. I spoke to you guys on Thursday, and I agree with the callers that our well-being must include the concerns for our health and our individual liberties. I asked you guys last week to stop talking and take action. One of those actions was wearing a mask in public places, and Mayor Castor that same exact day did exactly that. And I just want to say to Mayor Castor directly, thank you for your extraordinary leadership. If it weren't for COVID-19 and social distancing, if I saw you in public, I'd give you a hug. But today, this responsibility falls to the Hillsborough County EPG. Ironically, as you've heard from the 3 previous callers, facial coverings is the most controversial of all of these mitigation suggestions that are made. One of the suggestions I made last Thursday was to have a mandated telework policy in the county. There are folks who are being forced to go to work and be put around individuals and then potentially open themselves up to the risk of contracting a virus and then taking it home, as happened with my councilman in Hillsborough County. If a mask will offer full protection, then why are all of you meeting virtually as opposed to in person? Because you know that it's not alone. So I'm asking once again for the EPG to mandate telework unless it causes an undue burden on an employer. This is one of the easiest and most effective ways to ensure that people stay home, that they don't have interpersonal contact that they don't need to have in the workplace. And also, as you've probably seen, transit workers now are contracting the virus, and some of that is because people are forced to go to work and ride in public buses and public transit. Thank you for all your work, and thank you again, Mayor Castor.
Al Smith.
Yes, good afternoon. This is Al Smith to Chairman Miller and to the rest of the EPG committee. Thank you. Again, I do echo the sentiments of the previous caller. Thank you, Mayor Castor, for taking a stand and supporting the mask wearing ordinance. And I just called to voice my support for the ordinance that we placed before you today regarding the voting on the mask ordinance. I think it's an important issue that needs to be addressed, and I know in the last Thursday's meeting I heard Chairman Miller's very passionate response as far as the question that he asked concerning what is holding the board back from making a decision when all evidence from the WHO, from the NIH, and other organizations support the use of wearing masks as mitigation of the COVID-19 disease. I spoke to my sister, who is a doctor up in the Washington area. Of course, she kind of travels around to the Northeast and New York and everything else. And she, too, I guess in Washington, D.C., they do have a mask ordinance up there, and they have mitigated the disease where it's not really that prevalent there. And I believe that because of the state of Florida fastly becoming one of the hot spots in the nation for the COVID-19, I think something needs to be effected to be able to mitigate this disease. I know that the mask, there's a lot of controversy about the mask, but I think anything that we can do to help mitigate this and to help stop the spread of this disease would be helpful. You know, I heard terms, you know, when Chairman Miller asked this question, I heard terms such as, you know, my email blowing up, my constituents, but I just wanted to voice my support in hoping that you all will vote in ordinance of the mask, the temporary wearing of the mask ordinance. Thank you.
Mr. Brewer, did Dane Zimmering call in?
No, sir.
Okay, thank you. Erwin Watson? Erwin Watson? Mr. Brewer, did he call in? She call in?
I believe it's Aaron Watson. Are you on the line? They're not speaking, sir.
Commissioner,
okay.
with HTV, Aaron Watson has dropped.
Pardon? Pardon?
Aaron Watson has dropped from the call.
Okay, all right, thank you. Danielle Williams?
Hello, my name is Danielle Williams, and I'm a Hillsborough County resident and employee. Thank you, Mr. Chairman and board members, for your time and careful consideration. I listened to these meetings from the beginning. The last meeting was alarming as a citizen with liberty in America. I'm calling as a concerned citizen after listening to the last meeting. We are experiencing an overreach of government. This group reported an increase in cases. What is the exact increase? Is it just 1%? There are no reports on recovery rates. One doctor on the last meeting said there will be bodies in the streets. This is impossible. At the peak of this virus, the death rate was 1% across the nation, and the same is here. The Hillsborough County website reports that out of 1.42 million people, 5,973 cases of COVID, 115 deaths, and 574 hospitalizations. Again, there is no report on the recovery rate. Please vote no. Please repeal the mask mandate in Tampa, and please vote no on the mask mandate. Please stop restricting our lives, business, and freedoms in America. This is hurting families, businesses, employers, and churches. Please vote no on mandating masks.
Our last speaker is Shannon Gilbert.
Thank you, Mr. Chairman and members of the group. My name is Shannon Gilbert. And I just wanted to take a moment just to voice my thoughts and my opinions here on why we should not mandate the mask. One of the things, if we want to look at data, we see that the information that is being provided is skewed, and so you cannot extrapolate accurate information. When we look at May 29th, information that was actually released by the WHO says healthy people should not wear masks only when tending to COVID-19 patients. And Dr. April Baller, actually, who is a public health specialist for the WHO, noted if you do not have any respiratory symptoms such as fever, cough, or runny nose, you do not need to wear a mask. So where is the method of consistency? And so we've seen that the board has totally overreached in many different cases. And what we find this to be true and evident, according to what the WHO has stated, we find it evident in the healthcare workers field that nurses who are dealing with cancer patients or others who are dealing with compromised immune systems are told that they are not to wear masks unless they are dealing with the COVID-19 patients because also of the limited number of masks. Now, masks being mandatory causes quite a few challenges. Well, let's look at, for instance, with our law enforcement. Now you have everyone running around with a mask. I'm sure as Mayor Castor, who's been a former police chief, as Sheriff Chad knows, when you have everyone running around with a mask, that puts them at a liberty of committing a crime with identities being concealed, and it makes it harder to even bring these people to justice. So we're talking about civil unrest, which has started, and even just over the weekend, we had officers who were ambushed, and that never made it to the publicity, but it is there and notable. And so when you talk about this, wearing out the mask consistently, it is that it weakens the immune system. And with the coming flu season and a supposed second wave, that will have a catastrophic outcome, a horrendous outcome of more people being sick after we have literally signed up and destroyed their immune system. So it provides a false sense of security when we know that only the N95 mask has actually proven. So now we have people putting themselves in a place of contracting it, thinking
Thank you very much, sir. Your 2 minutes are up.
When they
Thank
do
you.
not.
That was our last speaker. We now move into emergency management update. Mr. Dudley.
Good afternoon. Okay.
Good afternoon, sir.
We continue to support home testing in our 7 collection sites located at Raymond James, Lee Davis, South Shore, Plant City, Brandon, Waimama, and Sun City Center. Testing conducted last week as the close of business, 4,596. Total tested today, a little over 33,000. We had 3,896 appointments scheduled for last week. We have 2,903 appointments scheduled for this week. You can continue to call and schedule appointments. Please use 813-272-5900, 8 to 5, Monday through Friday. Logistics. We have 5,328 collection kits to support our efforts, and we continue to have a steady delivery on a weekly basis. PPE, we continue to push PPE out, received from the state. Under a new state initiative, we've received a large order of cloth masks, and as of this week, we will have pushed out 20,000 to Hillsborough County Sheriff Office, 600,000 to the City of Tampa, 70,000 to Plant City, 70,000 to Temple Terrace, Feeding Tampa Bay, 60,000, Tampa VA, 100,000, Hart, 30,000, Sunshine Line, 15,000. This is just the first delivery coming here to the county. As we continue to receive these, we're going to work with community relations and other community partners to ensure that we can get these supplies out as quick as possible. The school board will also receive their distribution being pushed out here to the county staging site as well. We'll begin to receive those supplies for the school board this week. After June 30th, drop-offs for the medical supply donation must be scheduled in advance by calling 813-221-6561. We have had no changes in donation numbers at this time. Again, after June 30th, please call 813-221-6561 to schedule any drop-offs. We have 0 guests in our quarantine site, and we have 21 guests in our isolation site. And this concludes my update, pending any questions.
Thank you, Mr. Dudley. And I see Commissioner Overman, you recognize.
Thank you. And thank you, Mr. Dudley, for your report. Our office is getting a significant number of calls regarding having difficulty getting through. And I know you guys are really trying to ramp up the issue. What would you recommend we share with the public on how that needs to be addressed? Because I've had lots of friends call, I've had people call, I've had reporters call, and they are very concerned about not being able to get through to schedule an appointment. So can you help me with this?
We ask there's a significant demand for testing throughout the community, not just here at the county level. We ask that you continue to be patient and continue to call the helpline once in the queue. There's about a 33-minute wait in the queue. We are experiencing some technical difficulties, but our technology folks, they're here on the ground today to continue to help us overcome this. We added 10 agents last week. We added another 6 call agents again that'll be online this week. And we're hoping to get to launch the online registration this week also to provide continued relief. So high demand. We're doing the very best we can to resolve those issues. We'll have some new technology in place for you this week to help with that, and we're putting the extra people there. Just continue to call, and we'll get you in just as soon as we can.
Thank you very much. I appreciate that.
Mayor Castor, you recognize. Mayor Castor?
Sorry about that. That was going to be one of the questions that I asked as well, but also I want to thank you, Mr. Dudley, for your partnership in supplying the masks to the city. We were able to pass out over 120,000 to our residents this weekend, and couldn't have done it without you. So thank you very much. That's it, Chair.
Thank you, ma'am.
Thank you, ma'am. And I also wanted to commend your emergency management team. They put together a quick plan to get that launched out. So they did an outstanding job on that. And we'll continue to support those efforts for as long as supplies last.
Thank you.
Commissioner Merman, you recognize. Commissioner Merman?
Okay, I did speak with Ramin Kuzkani. He's our CIO here at the county. He told me that online reservations will be going live on Thursday. So I think that should help with the call volume and people being put on hold. And of course, we're still getting the fact that they're not coming back to them after they've waited for the 33 minutes. So I think that's, continuing to be a problem, but I do think the online issue will help a great deal. So I wanted to let everybody know. He said I could tell everybody about that.
Mr. Merrill, you recognize.
Yes, I also just want to mention that we're working with the state of Florida Emergency Management to take additional resources from them that they have offered for collection and testing. And hopefully we'll have that worked out today or tomorrow.
Okay, thank you, sir. Ms. Snively, you recognize.
Thank you, Chair. Thank you, Mr. Dudley, for your report, and thanks to you and Commissioner Merman for that update on the online capability of making the appointment. Just wanted to also thank you for the donation of masks to the school district. How do you know off the top of your head, or is it in front of you, how many masks you're able to donate to the school district?
I just prior to coming on here, I just received the email from the state. I have to take a look at the numbers, but you're going to receive enough masks to cover your social workers, psychologists, librarians, instructors, pretty much your full staff complement. But I'll have to pull those numbers for you. But I know it's a significant amount to cover your staff.
Thank you. Are those reusable masks or are those disposable masks, or do you know?
They will be cloth masks.
Cloth masks. Okay. And when you have that number, would you mind sharing that with us? Maybe you can have that on Thursday's phone call. We appreciate it.
Absolutely.
Okay. I don't see any other questions. Thank you, Mr. Dudley. We appreciate it very much.
Thank you, Mr. Chairman.
Dr. Holt, you have a full schedule today, sir.
Yes, sir. This is Dr. Holt, Florida Department of Health, Hillsborough County. I'm going to do an abbreviated epidemiology update, hit the highlights, takeaways. The full PowerPoint has been made available. But the key takeaway is that we are seeing quite a bit in a surge in what's termed community-based transmission. Then, per request through the members, the speakers will be Dr. Charlie Lockwood, the Dean of Morsani College of Medicine. So he'll speak about the importance of science and how evidence evolves, also the impact that COVID transmission has on us as a community, live and work during our reopening. We're going to take a deeper dive into the impact of the number of cases on our medical systems. John Couris, the CEO of Tampa General, will provide a sort of high-level perspective, followed by information on the emergency room impact from Dr. Jason Wilson, who will also present experiences at both Tampa General and the others, 4 hospital systems, and then the 4 hospital chief medical officers, Dr. Chang, Dr. Anand from Baycare, Dr. Ardwan from Adventist Health, and Dr. Harmats from Brandon Regional HCA. We'll talk about the impacts on the hospitals inpatient-wise, and then we'll close with Dr. Sita Lakshmi, who's going to update on the current evidence and science being behind the mask. I would note a bit of viewer discretion. I did review her presentation today. There are some images of patients with full releases, of course. Commissioner Miller, I've asked each of the presenters to be brief. Normally, we do ask questions after each section or each presentation. Really sort of up to you and the committee or the members, whether it's better to hold them toward the end or after each. And I would like your guidance on that.
Dr. Holt, each area is dealing with somewhat of a different area. I'm looking at this healthcare providers, the mutual goals, protecting public health, then you have a current and looming crisis in the community, then you have the data analysis, then you have the impact of the healthcare workers and the scientific evidence of patient. I would ask that if it's okay with the presenters, that after each presenter, if there are questions, make them very short. Don't give a dissertation with your question. Just ask the question and let that person respond in a very short period of time. I think we can reach our goals of having the questions asked right after the presentation, so that we have it fresh within our minds and in our conversation. If that's okay with you, Dr. Holt.
It's completely at your whatever your will is. Certainly,
we'll do it. We'll do it after every presentation. But members, please don't give a dissertation with your question. Just ask the question so the presenter can answer your question, and we can move on in the agenda, because it's a very intense agenda. Okay. Good, Dr. Holt. Proceed.
Okay. We'll begin with Kevin. Will show our observations. It's a single slide. Overall, we're seeing, again, as I mentioned, evidence of significant widespread community-based transmission. COVID, as we're learning, moves very fast. It builds a lot of momentum, and it can explode. We are seeing similar patterns across the state, as has been noted by Governor DeSantis on Saturday. As of June 22nd, the total number is 5,973. That's for all cases, Floridians and non-Floridians. As Kevin's report, we have 5,512 as of yesterday. Note that this is an increase of 4% in literally one day. Our age group remains the same, 25 to 34 predominance, but especially the younger than 34. You look at our rolling 14-day average, it continues to show increasing. It is now 200 a day. But I would focus, and I'm going to focus on the last 4, which has been somewhat unusual. And for the past 4 days, we've seen 360 cases a day. Our rolling 14-day test results for the 14 days are 1,900. We've now tested approximately 7% of the population. Good news is that it's continuing to increase. The average on the last 4 days daily is 2,000. Our positivity rate for the 14 days currently average is now just over 11%. Again, focused on our last 4 days, it spiked to 18%. Again, all of these, both the number of cases and the positivity rate, as noted on a statewide basis, reflects some increased community-based transmission. We are seeing some daily admissions increase from the hospital, trending upward. I would note that the total numbers have gone up from 173 on June 15th to now 217. That's about a 25%. The ICU admissions have increased from 40 to 44, or about 10%. When you look at the hospital beds and ICU beds, as far as the occupancy rates, the hospitals are continuing, bottom line, based on these availability beds, are not stressed as far as their percent of occupancy. Our deaths for the past 7 days were 12. That's, again, unchanged for the prior. Finally, Kevin, next slide, just to give a regional trend and an update for the, just to get a picture of what's going on in the other counties for the past week. This is still a little dated. I haven't gotten it fully updated. But if you focus on the far right, we're not alone. We're seeing increases across our local county neighbors. As we talked about contact tracing, just to give you a bit of our patterns, we are seeing increasing examples of friends and coworkers going out to an establishment, and whether they infected each other before or during, but they did have in common going to one of the entertainment venues. Restaurants predominantly are coworkers that we're seeing. Again, we don't know if they were infected either outside of the restaurant or by their patrons. Seen some interesting examples in our sports, particularly indoor hockey and volleyball, where players have tested positive as a group. I would note that some of the major exposures probably don't happen while they're playing, but the before and after. And we have seen, again, some examples in our gatherings, whether it's for religious or other type of purposes. Healthcare workers, there's been surges in the non-work related reports of healthcare workers. I would note on a positive note, the long-term care facilities have really shown to be much, much less of a risk. Governor DeSantis' program of extensive testing that's going to be followed up by some targeted resident testing, and all the staff every 2 weeks has resulted in a significant reduction in the past 2 weeks of the number of cases associated with long-term care. The risk appears to be predominantly, again, people or staff contracting outside. So in conclusion, as noted, and I fully agree with Governor DeSantis, is that the good news of the increase that we've seen is not expected. The good news is they're young. The bad news is the positivity rate reflects significant changes in community-based transmission. Therefore, the emphasis is shifting back towards our mitigation, specifically social distancing and facial mask covering. The governor has undertaken an effort to re-educate, particularly those of the most vulnerable, to avoid being exposed, whether they're out or in some cases even at home. He's enforcing the statewide capacities of our businesses through our DVPR, and he certainly gets that Social distance is critical, and use of mask is important for those when you can't social distance, particularly face-to-face and indoor. And these decisions should be made locally, and he's assisting us by providing the cloth masks for distribution. Commissioner, I'll stop there and be available for questions.
Thank you, Dr. Holt. Mayor Ross, you recognize.
Thank you, Commissioner. Dr. Holt, just a quick question. Some weeks ago, we saw an increase in hospitalization that was due to some preemptive hospitalizations in order to isolate some older people from long-term care. Is that still a significant portion of our hospitalizations, or has that number kind of dropped off and now this is truly sick people?
Yes, sir. It's a great question, and I'm happy to have our hospital representatives to confirm this, but my data shows that the percentage of the hospitalization patients recently reflect a very minor number of long-term care transfers, sir.
Okay, thank you, doctor.
Yeah. Okay, Dr. Holt, you can proceed.
Thank you. Next, I'd like to introduce Dr. Charlie Lockwood, Dean of USF Morsani College of Health, USF. Dean Lockwood.
Thank you.
Good afternoon, Dean Lockwood.
Thank you. Good afternoon, Chair Miller and commissioners, mayors. So I wanted to just kind of give you a little brief background on what's known about the science behind this virus. And there's a lot more known now than there was 4 months ago. It's extraordinary, the amount of information that's been collected, the amount of data that's been collected. It's unprecedented in the history of medicine. So this is an RNA virus. It's actually a part of a very common class of viruses. Coronaviruses cause 25% of the common colds. This is not at all like those very benign coronaviruses. This one is much more infectious than influenza. It's about twice as infectious as influenza. And it is about 20 times as lethal. We were hoping that that wasn't the case, but it does seem to be the case. The case fatality rate, so that's the number of cases, the percentage of cases that die as a percent of the total cases for the state is about 3.6%. Actually, Hillsborough County has one of the lowest case fatality rates in the nation, and that's in large part because we have a younger population. We've had a younger population from the start, and of course, great healthcare delivery. We made a lot of progress about understanding who's at risk, and older folks over 60 are at risk. People with an A positive blood type, unfortunately O negative, but if you're an A positive blood type, you have a significant increase in risk. If you have diabetes, hypertension, chronic lung disease, or heart disease, you're at significant risk. If you have any kind of immunodeficiency, and those things are additive. So if you're a 70-year-old who smokes and has emphysema and is an A positive blood test, I don't know that I would want to stray far from my house. On the other hand, young, healthy folks are at much lower risk. There's some evidence that asymptomatic patients, even though they have no symptoms, may have some residual lung disease, but for the most part, they do pretty well. Now, what I wanted to do is kind of emphasize the change in this epidemic in Florida and particularly in Hillsborough County. So testing, and I take some credit for the nagging of everyone for increasing testing. Testing has increased from about 1,200 tests per day the week ending June 3rd, with about a 96% test negative rate, to about 1,900 tests per day the week ending June 17th, with about a 95% test negative rate. And over the past 5 days, we've had an explosion of testing so that we're now doing about 2,400 tests per day, but there's been a steep decline just in the last few days in the test negative rate to less than or equal to 90%. And a couple of days, I think it was June 18th and 19th, the test negative rate had dropped to about 78%. So that's a big change. Simultaneously, the number of cases over the 3-week period have increased from 55 a day to 180 a day. And over the past 3 days, actually the past 5 days, about 340 a day. The average age of cases has dropped from 48, which was young for Florida at the time, on May 20th, to 41 on June 17th, to 37 today. So there's been a steep decline in the age of cases. And that's something that the governor has talked about extensively. And the peak age group now seems to be between 25 and 34, but really between 15 and 40. So to summarize, there's been a 6-fold increase in cases and a 2-fold increase in testing. So there's a little mismatch there. And the average age of cases has dropped by about 25%. Now, if you all will remember, back in May, we were only testing really symptomatic patients who were very high risk. And we weren't testing exposures. We weren't testing asymptomatic patients. And so now we're testing pretty much anybody that wants to be tested. We've set up a lot of testing sites for the county. USF Health's been proud to help with that. Obviously, all the hospitals now have multiple testing facilities. USF Health does as well. So we're picking up a lot more asymptomatic patients, what we call pre-symptomatic patients, the patients that haven't quite developed overt symptoms yet, and milder cases. And we would have missed virtually all of those even a few weeks ago, and certainly a month ago. And most of those categories actually are disproportionately weighted toward younger folks. So we're definitely picking up a lot of previously undiagnosed cases. And the question really is, as some of the initial commenters questioned, is there really increased spread? Well, we can answer that in a couple ways. One is that if, in fact, testing really were occurring, increased testing were occurring in the face of a stable disease spread, you'd expect the case negative rate to go up to be 98% or 99%. And conversely, if in fact there was a tremendous increase in cases and no increase in previously undiagnosed cases, you'd expect it to drop. Spread is occurring rampantly, and you'd expect that case negative rate to, given the numbers, to be around 75%. So in fact, we'd done pretty well in the county. We had a test negative rate that remained very stable between 95 and 96% right up until June 17th. And then the floor kind of gave out from under us. We've had a progressive drop in the case negative rate, which is now kind of averaging about 90%, but in a few days last week was much lower than that. So there is absolutely no question from an epidemiological perspective. We can conclude there's been an increase in cases due to both more testing, but more recently due to the rapid spread of the infection among younger folks. So that's really not at all, I think, in dispute from a statistical standpoint. But there are actually other lines of evidence that support that. So one is that you have to assume that those young people are getting infected because they're not using face coverings, they're not socially distancing. And the evidence to support that is that when you track mobility in Hillsborough County based on cell phones, and you track the density of gatherings based on cell phones, back in the end of March and early May, as a result of the first stay-at-home orders, we were a B, according to one model, the Unicast model. And over the last week and today, we're an F. So there's a lot more social mobility. There's a lot more social density. And that's pretty strong evidence, I think, in favor of the hypothesis. The other thing that's alarming is that before you have overt symptoms, you might show up in the emergency room with a fever or cough. So we call that influenza-like syndromes or symptoms. Or you might have a fever, a dry cough, and shortness of breath. That would be COVID-like symptoms. The rate of those have dramatically increased in the county. So emergency room visits in the county for COVID-like illnesses back in May, in the middle of May, were about 191 a day. And now they're almost 500 a day, 460 by last count. And that mirrors the statewide increase as well. So remember that hospital admissions are lagging indicators. So it takes a couple of weeks to be sick enough to go into the hospital, or certainly at least a week. And then deaths, fortunately or unfortunately, are an even more of a lagging indicator. And we're beginning to see an uptick in hospitalizations, not a big one, and not one commensurate with the increase in cases, because these are young folks, and young folks tend to have 60% of folks under the age of 25 are asymptomatic when they have COVID infections. And of those that are symptomatic, 80% are mildly affected. So you don't see many of those folks in a hospital. So we're not yet seeing it. The problem is that those young people will go home and they will infect their parents or their grandparents or their older neighbor or their employer or their teachers. And those folks are at increased risk for death. So this is a big concern. You're beginning to see anecdotal evidence of that. You'll hear that Tampa General has had about a doubling in their ICU admissions, a doubling of the number of patients on a ventilator in the last week. So we're beginning to see very early signs of what could be a big increase in hospitalizations. Now, as some of the initial speakers pointed out, the good news is that the actual cumulative incidence of COVID-19 in the county is only 4 per thousand, and that's based on our RNA tests that we've done, which identify infectious and newly infected people. But we've also had some very good, elegant studies done at Tampa General with antibody studies that suggest the same thing. About 4 per thousand folks have had the infection in the county. Now, you're only infectious for about 7 to 10 days and 14 at the most. So the active number of infected people right now in the county is about 1.5 per thousand. So that's good news. And it means that if we act immediately we can avoid a serious public health challenge. Now, one of those earlier speakers said that masks haven't been proven to reduce the risk of infection. That's not true. Masks will reduce the risk of infection by about 6-fold. And when you wear a mask, you're protecting other people from you. So if everybody wears a mask, we would have a dramatic reduction in the occurrence of this infection. And of course, social distancing is also important. So I'm a big fan of history. I end to kind of paraphrase Churchill's plea to Roosevelt for more war material, that at least in terms of wearing masks, this is the thing to do now. And I would strongly advocate mandatory face coverings as has been suggested and proposed.
Sure.
Thank you, Dr. Lockwood.
Chairman Miller.
I'm trying to see. Yes.
Chairman Miller, this is John Couris. I just need to add something because I know this is a public call. I just need to add something.
Yes, sir.
I'm John Couris, the CEO of Tampa General Hospital. I completely agree with what Dr. Lockwood, our dean, articulated with 2 corrections. One, we've seen roughly a 30% increase in general hospitalizations for COVID patients at TGH. But we've had 5 patients on ventilators, and that's been pretty stable over the last probably 2 weeks. I just wanted to clarify that, just because I know that this is public. So those are 2 items. And then finally, I completely agree with Dr. Lockwood that the time is, we need to act now, and masks are critically important to help blunt the increase of this virus. Thank you.
Oh, okay, Mr. Couris, thank you very much. Dr. Lockwood, you were done with your presentation?
Yes, I am. Thank you.
Okay, thank you, sir. I don't see any questions for Dr. Lockwood, a dean at a great university. I have to say that. So, thank you, Dr. Lockwood. Mr. Couris, okay, hold on, Dr. Lockwood. May I cast you have a question?
Just really quick, Dr. Lockwood, thank you for the presentation. And you said, you have said all along that we should be testing 2,250 individuals a day. Now, as we see these increases, would you see a need for that to raise up, or is your overarching answer we should test as many people?
Yeah, we've actually hit the target that I've been nagging everybody about, which is 150 tests per 100,000 per day. And I think we've done a pretty good job with our contact tracing. And kudos to Doug and to our College of Public Health for all of that. So I think we actually now have the basic testing infrastructure in place. What we're missing is the mitigation strategies. You don't, it doesn't just go away, because we have to actually do something actively to make it go away. And that means isolating folks that are infected once you detect them, and keeping them out of harm's way. One of the really big problems we have with this virus is that young folks tend to be asymptomatic. And so we don't necessarily know that they're infected. And that's why it is vitally important that we, especially with young folks, have them wear face coverings and socially distance. If we don't know that they're infected, we're not going to test them, and they're going to spread the infection. And the asymptomatic folks don't spread it as much. But in contrast to what the very controversial speaker at the WHO said, they are infectious. They're probably about half as infectious as symptomatic folks. So again, young people represent kind of a double threat, because they're not being adherent to social distancing and face coverings, and they tend to be very mildly affected or asymptomatic. So they come home, they're sneezing and coughing into grandpa's, not to personalize this, face, and it's me that gets infected, and sick, not them. So that we're where we need to be with testing, and that's great, but we've got to add these mitigating strategies that you've already implemented, actually, thank you, in the city.
Mr. Nabby, you recognize.
Thank you, Chair, and thank you for your presentation, Dr. Lockwood. All valuable information for us. And I had a few people reach out with regard to testing accuracy and false positives, wanting to know what the rate of accuracy or inaccuracy or inconclusive tests are, and what's the rate of false positives. Are you able to address any of that?
So the two different kinds of tests right now, right? There's the nucleic acid test, the RNA test. That's the nasal swab and the oral pharyngeal swab that I hate doing because I make everybody gag. And that has almost a zero false positive rate. The problem with that test is false negatives. So there's inherently about a 20% false negative rate. So even when I swab somebody perfectly and they gag and I do all the things I'm supposed to do, the fact of the matter is there's a 20% false negative rate. That's why we often recommend repeat tests, because when you do two successive tests, you lower that false negative rate. The antibody test has the false positive rate, and that's why we're concerned about it. It's why we're not advocating doing a lot of antibody tests. So right now I mentioned that the prevalence of the disease in the county is about 4 per 1,000, the cumulative incidence. So that means 4 per 1,000, or 0.4% of folks have had the infection and they have antibodies. Problem is the false positive rate of most of these antibody tests are between 1 and 5%. So if you think about it, if you have, let's say, a 4% rate of false positives, there'll be 4 people per 100 that have a positive result, but only 0.4, 1/10, that are actually immune. So if we tell somebody, hey, you're immune, you do whatever you want, you don't need to wear a mask, go back to work, we're going to be wrong 9 times out of 10. So that's why we're concerned about the false positive test. But for the diagnostic tests, the nasopharyngeal and oropharyngeal RNA tests that the county's doing and that the hospitals are doing and USF Health's doing, it's the false negative rate that we worry about. I hope that answers that question.
Yes, thank you very much.
Okay, Dr. Lockwood, thank you very much, sir. Dr. Holt?
Yes, I'd like to pleasure honor to introduce John Couris, CEO of Tampa General Hospital. Mr. Couris.
Well, thank you very much. I am actually here really to represent and support my team of physicians, scientists, as they talk about the science behind the consideration to use masks. I would like to recognize the mayor of Tampa for stepping out smartly around mask usage in the ordinance, because as Dr. Lockwood pointed out so eloquently, masks work, and there is clear science that support it, particularly, as our governor has said, if you can't socially distance, if it's hard or impossible to do that, mask coverings are critically important. And I am simply here to support my team and answer any questions throughout the presentation. Thank you.
Okay. Any questions, Mr. Couris? No questions. Thank you. Dr. Holt.
Yes. Next is Dr. Wilson, Jameson Wilson. He's the medical director for Tampa General's emergency room, but I know has been in touch with his colleagues and give us a report from the emergency rooms.
Thank you, Dr. Holt, and good afternoon, Emergency Policy Group members. I wanted to do two things, both give you a report from what we're seeing in the emergency departments, both at Tampa General and at the other emergency departments in the county. Quickly before I do that, I also wanted to represent myself as one of the Healthcare Advisory Board members. The Healthcare Advisory Board for Hillsborough County did meet on Thursday. We had a motion to support face coverings in the county. That unanimously passed. Dr. John Corin, unfortunately, our chair, had a death of his brother, unfortunately, this weekend. So he was unable to draft a letter. I'm sure Mr. Early could supply the members of the group with confirmation that vote did occur. I will move on to my role as an emergency medicine physician now at Tampa General, and also some of the conversations I've had with colleagues throughout the area, both at Advent Health and the Bay Care system and at HCA. I would basically say that through those conversations, the story I'm going to tell you is the same story at all of our institutions, or at least is a reflective story of all of our institutions. And that story I want to tell as somebody who's been involved in our COVID operational response, seeing COVID patients daily, worked last night in our COVID area of the emergency department. We have a rapidly changing pattern and a rapidly escalating epidemic here in the area. If we go back to March and think about what we were seeing in March, we were still really seeing a type of case presentation where the median age of cases was in their 60s. So we had fewer patients with positives, and most of those patients were older, had a number of immune problems or other medical problems, leading to the probability that they were going to get sick. What we've seen over time, and really in the past week and a half, though, is a very rapid, I think Dr. Lockwood said the floor dropped out, or Dr. Holt did, and I think that's a good analogy. We saw a very rapid onset of a change in that pattern where the median age of cases has essentially halved. We're down into our 30s now, I think, with the median age. Now, there's two parts of that picture I want to tell. One part of that is the enormous amount of healthcare resources we're dedicating to trying to figure out who's positive and who's negative amongst that group and how to mitigate that. The other part of that story, though, that Mayor Ross brought up, Vice Mayor Ross brought up, that I think is important to tell as well, is that we've also seen a change that we had a strategy for about a month and a half or so of trying to cohort outbreaks, thinking about where are the hot spots, where are the nursing homes, where are the group homes, where are the places that we can maybe go to and proactively try to prophylax something from occurring. And most of the cases we were bringing to Tampa General, I would say, when I was working in the emergency department COVID area in late April and most of May, were really people we kind of expected to be positive, and we were bringing in on purpose, or we were bringing in to help with county, attempts to quell the pandemic in certain areas. I'll tell you, last night I admitted 5 patients to the COVID unit that were COVID positive. These patients were not from group homes. One of the patients was a young man in his 40s who had no other medical problems, and he was very sick. We are seeing a change there. Now, the other thing I want to talk about a little bit as well, and this is something that was reflected in my conversations with Advent Health, HCA, and Baycare Emergency Department colleagues, was that we are now also beginning to try to dedicate enormous amount of healthcare resources to taking care of screening those patients for virus, diagnosing whether they're positive or negative, while trying to balance other emergency department duties. So fortunately, what we have seen is that people who want to come to the emergency department for emergencies are coming back, and that's a good thing. I think every hospital in this county is safe. I think every emergency department in this county is safe. We've all had a lot of practice now. We've had a lot of lead time to design strategies around how do we cohort patients who are positive and who are negative into different areas. And so we are seeing a rise in that volume. But what was different about the last 2 weeks is we saw that rise in that volume return to about 80 to 90% of normal, was that we also started to see a slow increase of sicker older adults coming in and being admitted. So that's what Dr. Lockwood referred to and Mr. Couris referred to in terms of that rise of ICU admissions. But then on Wednesday, we saw the floodgates open for young people who had been exposed to virus, mostly in social situations, either through their own social events or through bars and restaurants. And we saw a very surprising prevalence, the number of people who tested positive. We were, I think, all surprised to see that number was in the double digits, well over 10%. So just to give you some ideas, in history, our ER at Tampa General, in the decade that I've been there, our highest volume day was in the 320s. On Friday, we saw 305 people alone in just the testing area of the emergency department, and we saw 520 people in the emergency department. And like I said, we have expectation that over 10% of those tests will be positive. The concerning part about this too is that as those patients, begin to come in, that means we have to mobilize resources there. We have to put providers there. We have to utilize nursing, hospital administration, time, and these are all efforts away from taking care of the patients that have emergencies, certain need surgeries, other normal hospital operations. So I would challenge that death and ICU are not the only metrics sometimes that we should consider when we think about the overall strain on the healthcare system. I wasn't here in February or March or April saying that we should wear face coverings, and there's a reason for that. And to allude to Dr. Lockwood's comments about Winston Churchill, that the timing is everything. And what we've seen is a shift in the pattern, and that shift in the pattern is to younger people. And so those younger people are in social situations. Our older folks were already kind of isolating themselves anyway. But these older people, now younger people, mean that we're also seeing a change in the presentation of disease. So before, if you had COVID, you probably had some symptoms of COVID. Now we're starting to see what other areas have told us was coming, which we had not seen yet, I would say, until about a month ago, which was the rapid increase in pre-symptomatic and asymptomatic spread. And so the concerning thing right now is that we don't know out there who has COVID and who doesn't, but we do know that young people are close together and around each other a lot. This is where social mitigation becomes really important if we want to keep on moving forward with where we're at in terms of trying to return to some semblance of life. So social distancing, facial coverings, which there is data for, as Dr. Lockwood alluded to, that decrease viral transmission. So I think the overall thing, I think that people really get a little mixed messages about when we think about these young people getting disease, that don't young people have a lower case fatality offer is that we know that some young people will get very sick, but more importantly to that, the more we know have this virus, the more and more older people or people with comorbidities are going to get this virus as well. So a small percent of a growing larger number becomes an increasingly larger number. Overall, we think about 20% or so of the patients who get COVID having some significant illness from that COVID. Whether they end up in the ICU or not, they may end up hospitalized or have long recovery courses. So as that growing proportion of young people have virus, the more we're going to see sick people with virus, and the more that's going to sort of overrun our healthcare systems. Thank you for the time.
Thank you, Dr. Wilson. Let me see if there's any questions here for you. Hold on a second, sir. Yes, Doctor. Mayor Ross, you recognize.
Thank you, Commissioner. I'm probably the only non-doctor here. So, Doctor, I have a question. It seems to me like what has changed here in the past few weeks is largely bars. And we're seeing this in the age group of people, not to generalize that everybody of that age group goes to bars, but that seems to be what's changed. And it doesn't seem to me anyway, at least from what I'm hearing from the medical professionals, it doesn't seem like these young people are catching this by passing somebody in the aisle of the grocery store. It seems like it takes two things. It's proximity and duration, if I understand correctly. And bars are the perfect incubator for this. If the music's loud, you have to be right in somebody's face and talking loud to be heard. And they're very densely populated, of course, even though they're restricted to 50%, those 50% pack in. So what's your opinion of that, Doctor?
Thanks, Mayor. So I would echo that one of the most dangerous settings we see right now are social events with long interaction, where people are close together, where people are talking loudly. That's definitely up here. I would also offer it's probably not a binary, right? It's probably not safe or unsafe. There's probably a spectrum of, there's actually a graph that's kind of floating around out there. On one end is two people playing tennis, and on the other end is essentially a bar. And there's kind of a spectrum in between. What I would offer is, as our prevalence rises and as asymptomatic case spread rises, where we are on that spectrum of what's safe and unsafe shifts. And so the problem we have right now is that we know there are people out there who have caught virus at bar, but are also with us in other indoor spaces. And we don't know which of those people are people with virus and are not without virus. And everyone has to grocery shop, right? Not just young people. And so my concern would be that people with other comorbidities, other medical problems, they also go grocery shopping too. This is still an indoor space and there is still a chance of spread depending on where we are on that spectrum.
Okay, Doctor, I understand. Thank you.
Thank you.
Before I call on Commissioner Ullman, I think the new positive cases for today came out a few minutes ago, and Hillsborough County had 393 today. 393. That, if I'm counting right, since last Tuesday, that's a total of 2,012 since last Tuesday. Commissioner Ullman, you recognize.
Thank you. Thank you very much. And Dr. Wilson, thank you very much for your report. In these folks that are actually being admitted, those that are coming into the hospital, are we finding out whether or not they had previously been wearing face coverings or not? Is that something you ask when you're talking with someone who's come in that's concerned and tested positive?
That's a great question, Commissioner Overman. We've actually been surveying our patients as they wait for testing. And what we actually learned over this past week, and Dr. Lakshmi may be presenting some of this data, so I don't mean to steal your thunder, Dr. Lakshmi, if you're going to talk about this, but what we have learned over the past week or so is that about people who wear face masks, less than 20% of those patients tested positive. And people who did not wear face masks, around 70 to 80% of those patients tested positive. So almost an inverse of the risk, whether you wore a face mask or didn't wear a face mask. We continue to survey our patients to get more data about that, but that was a sample size of about 50 that we had available up until last Friday.
Okay, Dr. Wilson, we appreciate your presentation. Thanks for being with us today. Stay safe.
Thank you, Chair.
Dr. Holt?
Yes, sir. The next presentation will be a group presentation. Dr. Chang will lead it off, and then I would ask him to introduce or pass on to each of his colleagues. Dr. Chang?
Great. Thank you, Dr. Holt. So you heard Dr. Wilson kind of give the state of the emergency rooms, not only here at TGH, but around the county. I wanted to spend some time elaborating on what's going on in regards to the collaborative that's occurring in between the hospital systems. So Baycare, HCA, Admin, and of course Tampa General have joined forces to create a regional dashboard. And this is as of late last week, but the numbers I'm presenting here, you can start to see this gray line is overall admissions. This orange line is our ICU admissions. And of course, this blue line is the number of patients that are ventilated. Now, I'll have to recognize that this is across 51 hospitals, but it doesn't include additional hospital systems outside of the 4 I just mentioned in 13 counties. So this gives you kind of an overall, I know we talk about Hillsborough County specifically, but this is kind of what we're starting to see in the region. As you look, we're on sort of an increase here in regards to hospitalizations. Now, you heard Dr. Holt say, from a hospital capacity standpoint, things are okay, right? And we want to continue to reinforce that. You heard Dr. Wilson talk about the numbers that were coming through the emergency departments. But really, I think the thing that I wanted to go into is more of the personal aspect of what our numbers are doing. From an admission perspective, when we talk about age, because we're spending a lot of time looking at the demographic that's becoming infected with COVID-19, 20% of all the admissions at Tampa General were in the 15 to 34 age bracket. So we can talk about elderly folks, middle-aged folks with comorbidities getting admitted. For us, the 45 to 65-year-old bracket represents about 50% of all of our admissions. So what we really start to see, and I know you guys have all seen these numbers here before, but as we start to look at the number of cases, yes, we do notice the preponderance of younger populations getting infected, but some of those patients actually get admitted. And the more patients that get infected the chances are the more patients that will get admitted. Since we, again, do have that 20% of all of our COVID numbers are 15 to 34. We can look at the 24-year-old patient who was admitted last night that's currently in the ICU and probably going to be put on a ventilator later today. Or we can talk about the 43-year-old young lady that lost her life earlier this morning. So COVID knows no age in regards to hospitalizations. We do see it across all age groups. To answer Mayor Ross's question earlier about the long-term care facilities, this spike right here in April, these two spikes were related to the two large outbreaks Hillsborough County had in our long-term care facilities, and they're sort of dwarfed by the size of the spikes that we're seeing now. This was our quote-unquote first peak at the end of March, early April. So that's kind of what we're looking at across not only here at TGH, but all of the healthcare systems in the county. And I think Jason also raised another great point that we're having to manage the COVID population in addition to the other acute and chronically ill patients that are coming in for normal hospital services that don't have COVID. So that's kind of where we're at right now. I just kind of wanted to give you a flavor of what's going on in the region, also here at Tampa General. And with that, I'll pass it over to Nishant Anand, who's one of the medical officers at Baycare.
Okay. Thanks, Dr. Chang. It's a privilege to speak to the group. I'll just add some qualitative analysis to what Dr. Chang alluded to. I serve as the Chief Medical Officer for the Baycare Health System and oversee our efforts in the 4 counties that we have the privilege of serving. What we've been seeing, a lot of my colleagues already alluded to this early data that we have. But what we started seeing in May, I think Mayor Ross, you had alluded to, we were seeing preponderance of our admitted patients at that time were actually from nursing facilities. Hillsborough County saw a big influx at that time. At one point for the Baycare Health System, 90+% of the patients that were admitted related to COVID were actually from a nursing home. As has been alluded to, the last couple of weeks have really shifted. The demographic has shifted to a younger demographic. We still receive patients from nursing homes, assisted living facilities, rehab facilities, but we're seeing a lot more community spread. When I look at the whole picture, and just to add some context on this, I'm seeing increases across all of our services related to COVID. We stood up a symptom checker or triage app that the community could use to check if they had symptoms of COVID and what they could do. We've seen a spike in that in the last couple of weeks. We set up a nurse triage line that's had a pretty significant increase over the last week. The calls are continuing to come in, and in partnership with TGH and the County of Hillsborough, we run the Raymond James Stadium with our clinical staff. And as of Friday, I believe we had about 700 individuals, a little bit south of 700 individuals coming in. When I look at our positivity rate, we're seeing increases in the positive rate of the people that we're testing. At one point, it was down in the single digits, 4 or 5%. We've been up. Our emergency departments are seeing 20% of the people that we're testing turn out to be positive. So 1 out of every 5 people that are coming in with COVID-related symptoms are testing positive. When we looked at our drive-through for last week at Raymond James, that was at 13%. Now, I know Dr. Lockwood explained that we are testing enough. I believe we should be testing more. If our percentage at 13% across the community of folks that we're testing are turning out positive, that means we're not capturing enough people. And with the number of people that are asymptomatic, I think we have to continue to test more individuals because the denominator needs to increase, and then that's going to actually increase. In addition to the testing front, that would be enough if you saw the triage app increase in the nurse triage, the people coming to our emergency department. The good news is most of the people who come to our emergency department are going home because they are younger, and we continue to monitor them. That being said, the total absolute number of people admitted to our hospitals is increasing. We have the highest census of COVID-related patients right now. If they're not from a nursing home or they're younger in age, they tend to go home in a couple of days, but we do see the exception. We've had young individuals that end up in the ICU and on ventilators. And so we are okay from a bed situation at this time, but I think as my colleagues alluded to, we are seeing patients that are COVID-related. We're seeing people that from a nursing home that are waiting to go back, and this is probably the area that worries me the most. And I have to commend Mike Merrill and his team in setting up the University Village. That's been a big help to offload the hospitals with that, and I think we have to continue to utilize that service. And as others said, we're also seeing an influx of people who've been off getting their conditions treated in the months of March and April. And so when you add all those factors together and you put the whole picture, I absolutely, all the data points that I see tell me that we're seeing an increase in people seeking out care for COVID-related symptoms. That's the Google flu. When you search for flu, the Google uses there as an early indicator. That's an early indicator for us that people are starting to have the symptoms and they're concerned. Then when we get to the testing rate, that's increasing, hospitalization rates increasing as well. And so putting the whole picture together, I do think that we are seeing an increase in the need for healthcare related. With that, I'll turn it over to my colleague, Dr. Harding.
Thank you, Dr. Anand. This is Doug Ardwan. I'm the president of the Advent Health Physician Network here in the Tampa Bay area, and I trust you all can hear me. And I want to thank the Emergency Policy Group for giving us time to discuss this very important issue. I just want to support everything that has been said so far. All of my physician colleagues have, in sharing what's going on in their own institutions, and of course, all of the medical and clinical expertise is definitely supported by myself and my other colleagues here at Advent Health. Just quickly, our own experience here in Hillsborough County and a couple of other areas where we have our facilities, we had been seeing a pretty steady number of inpatient COVID positive patients with a slight increase over the last couple of weeks, but we definitely saw a pretty significant increase over the weekend to where now we have over 100 COVID positive patients in the hospital and several others that are under investigation until we know the results of their testing. So we saw a significant jump over the weekend in our inpatient population. Of interest, we have noted that 40% of this population were patients that came to us from either nursing homes or assisted living facilities. So where there is still quite a burden out there in that population, we certainly recognize and understand what's going on in the younger populations across our county, as we've seen that traffic coming into our emergency departments as well. What I'd also like to thank the Dr. Holt and others with the county, and of course my colleagues with the work that we've been doing to coordinate our efforts working with the skilled nursing facilities and ALFs. And we have another meeting this afternoon, so we continue to make progress there. As of this morning, we had roughly 13 patients that had a discharge order and were ready to go back to skilled nursing, but at that time were unable to transfer, and I'll know the status of those when we do another report out at 5 p.m. this afternoon. So once again, just like everyone else, we've seen a pretty significant increase over the weekend, and but are grateful for the support from the county, from the city, and as you know, we're also in support of the masking ordinance that has been laid out there for this commission to consider. Thank you very much.
Okay, thank you, all of you. Let me get to a question here from Commissioner Overman. Commissioner Overman, you have a question?
Not yet. Not a doctor yet.
Well, see, your hand was up. That's why I asked.
Yes. I do have a question for any one of the physicians at the hospitals, but Dr. Wilson, because he's been working with all of them, may need to be the answerer. Given that we've seen an increase in spread of what appears to be positive testing to somewhere between 10 and 20%, depending on what area, if that grows again like it has in the last, say, 2 weeks or 30 days, how long will we be over subscribed to our hospital resources? And I don't mind having any one of them answer the question, but by that point, we're going to be behind the power curve, is my concern. Is that something that we need to address quickly in order to avoid being overrun?
Commissioner Overman, I can start, and I'm sure Dr. Chang may have some to add to that, and I know Dr. Lakshmi will address some of this in her presentation. But what I want to emphasize is that we're in an exponential growth phase. And so the problem with exponential growth phases is that we take off like this, not like this. And one of the concerning things when we think about case fatality rate is that while our case fatality rate is actually very good in Hillsborough County, when we look at places like New York City, which had a much worse case fatality rate, the problem was they got overrun. The healthcare system got overrun very quickly. As Dr. Chang showed, we have a very good data sharing and sort of resource sharing arrangement throughout the county. We're in good shape for preparing for that. But again, the problem is this exponential curve goes very fast. And so we are at a place right now where if these young people who are getting virus begin to transmit to even a small percent of people who are older, we're going to see that escalation of healthcare resource utilization go up very quickly. We are already starting to feel it. Just so you know, I'm receiving texts right now about trying to move people around in our ER because, in our spaces where we put COVID positive patients, more of those are filling up. I think Mr. Couris mentioned that we're up to 30% higher than we were previously. That number is going to continue to decline. We were really stable for a while. We saw a pretty stable number of patients in our COVID units, but we have all felt and seen that rapid increase overall. And so again, I warn people this is an exponential growth, and so it goes very quickly. I'm sure Dr. Lakshmi will show some numbers around that, and Dr. Chang may also have some.
But can I, this is John Couris, Chairman Miller, can I add to that, please, just for a second?
Yes, sir. Yes, sir, you recognize.
This is why it's incredibly important that both the community at large and the health systems work collaboratively together, and the way the community can help and continue to help is by wearing face masks when you cannot socially distance or it's impossible to socially distance. The institutions in Tampa Bay have been collaborating and working together very, very well with each other and with our physicians. And at the moment, we have the capacity to handle the cases that are coming into us. This is all about stemming the tide. And this is where both the public, along with the health systems, along with the county, come together to work as a team to mitigate and blunt the curve, and then hopefully contain and eradicate the virus.
Thank you. Thank you, sir. Commissioner Merman, you recognize for a question.
Thank you, Mr. Chair. And I think this is for Jason or anybody, but do all COVID patients come through the emergency rooms before they get admitted to the hospital, or do some of them come right to a hospital?
Hey, Commissioner Merman, that's a great question. Because we want things to stay very safe at Tampa General, as I'm sure all the hospital systems have done as well, we've really tried to streamline the entry points for COVID positive patients. And so while it is through the emergency department, it's through a designated space in the emergency department. So we have a piece in the department that has been moved over for COVID positive patients. So most of our COVID positive patients do enter through that way if they are symptomatic or being brought to us because they're symptomatic. Now, there are other COVID patients we identify who are not as sick, who we, through surveillance testing, have found who are looking to have surgeries or other procedures, and that's how we keep those patients from exposing hospital patients or hospital staff, is that they're moved into COVID units as well.
So are those people in your COVID unit, are they counted in your hospitalizations, or do you have to wait to see how they progress before they actually get admitted?
Sure, great question. So not all patients we see who are positive for COVID in the ER are admitted. So those patients would not be counted. We discharge the vast majority of COVID patients. So when we talk about admitting numbers of COVID patients, we're talking about a very small number of the iceberg that's out there. We're talking about the tip of the iceberg. We discharge the vast majority of our COVID patients, Commissioner.
Okay, and thank you all. Thank you for your presentations today and everything you're doing. Thank you.
Okay, Dr. Chang and Dr. Annan and Dr. Arduin, are there anything further you'd like to say?
Yeah, this is Dr. Ardwan. I think I was supposed to pass off to Dr. Alan Harmitz from Brandon Regional, so I didn't know if he wanted to make a comment or not.
Yes, thank you very much. Thank you, Mr. Chairman. Thank you, committee members, and thank you, Dr. Holt, for giving me the opportunity. I think the committee has heard a lot of data. I don't know that I'm going to have much to add to the data, but I'm going to hopefully add a little bit more granular information, unpack COVID a little bit more in perhaps a little bit more personal way. Just to add to it, I would say that out at Brandon, which everybody knows is out in eastern Hillsborough, we are seeing record numbers of COVID positive patients being admitted to our hospital, showing up in our emergency room, and the number of people being evaluated is the highest number. So we are seeing what everybody else is seeing. The thing that I want to share with you is that I actually had the disease. I contracted COVID. I am, though 62 years old, I like to think of myself as fit. I've engaged in sports and athletics at high level for my entire life. I've been extremely healthy, don't smoke, don't really have much in other risk factors. Except for the fact that I sat next to a colleague of mine who had acquired COVID through community exposure. I was probably within 3 to 4 feet of him for about 20 minutes. And he was, I say, asymptomatic. It turns out he was pre-symptomatic. Pre-symptomatic people can shed virus in very large numbers, and in point of fact, he did. I was one of approximately 4 others that contracted the disease as a result of a pre-symptomatic exposure. Initially, for me, I was very sensitive to the fact that we were trying to prevent spread, and I self-quarantined. Probably that was a Thursday when I was exposed. Monday afternoon was really when I began to notice that I had a little bit of a scratchy throat. The thing that I will share with you is that a surgeon, as a healthcare provider, we have a culture of working while ill. And prior to this, I would have thought nothing of it. I would have said, oh, this is just some allergy symptoms. The fact that I knew that any sort of upper respiratory and, in fact, many other symptoms might actually signal that I was coming down with it is that I isolated, quarantined, filled out a contact sheet, and waited to see if I was going to develop other symptoms. Unfortunately, my colleague did become symptomatic, was tested, became positive. I was tested, became positive. The thing that I will share with you is that this is particularly nasty disease. For some, it is relatively benign, others fairly asymptomatic. But that said, is that as we learn more and more about it, there's an IOU being written, and I'll get to that in just a moment. For the first 7 days, I'll tell you is that I certainly have been sicker. It really wasn't all that pleasant, but it wasn't horrible. On the 7th day, which is frequently when we will see people who are going to develop a severe form of the illness begin to decompensate, I began to decompensate. My breathing actually got a lot worse. And for the next 3 days, I really did nothing else other than concentrate on oxygenating. Deep breaths. I did exercises and walked around with an O2 sat monitor on my finger. Shortly after that, I noticed that I actually had some red spots on my toes. They were not particularly painful, weren't sore. It was rather odd to me. What we now know is COVID toes from being in a hypercoagulable state where our blood was clotting, and some of these clots were actually going to the end of blood vessels and getting caught there was something that I experienced. I did have some severe headaches and whatnot. That said, is that eventually, about 3 weeks later, is that I felt a lot better, eventually tested negative, and went back to work. The IOU that I'm talking about is the fact that one of the things that is emerging, and I'm sure that perhaps Dr. Lakshmi and others can speak to it more articulately than me, is that this has a systemic effect upon your health. And some of these are going to be long-lasting. I can tell you, for one, is that my blood pressure has always been on the low side. I've been 118/60 for many, many years. Since this is that I am now in the 130s, and my diastolic to bottom number is significantly higher. So for each and every patient that develops COVID that becomes positive, if you think of this in terms of what we are going to be spending immediately in order to treat these people immediately, in order to stem the tide of disease, we're also going to be spending on the back end. I think as we go on, we're going to be seeing this, the longer term effects on the overall health of the population are going to become much more apparent. So, and again, as we've all seen too, even in children, Kawasaki's disease has been something that's been identified as a sequela of having had COVID. So that said, is that I'm going to stop there. And once again, I just want to say is that while I'm not in charge of what our community standards are, I wouldn't presume to that. My job is to deliver health care to the best of my ability to the standards of the community. It would be my recommendation that we actually commit to NPIs, non-pharmaceutical interventions, not just masking, but others, because I think it's going to pay dividends, not just immediately, but potentially for years to come. Thank you very much.
Thank you, Doctor. I'm glad to hear that you're doing better, and I hope you continue to do better. Just to continue to be careful. Thank you very much, sir. Thank you. I don't see any questions at this time. So to all the doctors that were on here, Dr. Chang, Dr. Annan, and Dr. Hodadin, thank you so very much for your presentation. Dr. Harmatz, thank you so much too. We appreciate it very much. Dr. Holt.
Yes, Commissioner. Finally, this is Dr. Sita Lakshmi. She's an infectious disease specialist at USF Morsani College of Medicine. She's also the associate epidemiologist at Tampa General. Dr. Lakshmi?
Yes, hello everybody. Esteemed chairman, mayors, representatives of the elected community, my DOH colleagues, and my beloved Hillsborough County community. I want to give a little introduction on what the numbers you've heard and put faces to the numbers today. But having said that, a little introduction about me. I am an infectious disease doctor. I'm also a trained epidemiologist. I see patients, I teach, and I'm also working with the local business communities on answering questions on reopening, along with Tampa General and USF program for reopening the community safely. When I'm not at work, I have a 3-year-old son, and I run a business with my husband on old cars. So I have a vested interest in the health of the community as well as the businesses. So today I'm going to spend some time on sharing the stories of the patients who are not fortunate to be here to share their stories with you and some of our healthcare workers on the front line as well. We'll talk a little bit about the masks and end with our own survey from internal data with Dr. Wilson's and others' help that we've been able to collect. Before we go on to the next slide, I want to warn the people on the line that there might be content on the slides that might be a little graphic, and if you are not ready to watch it, that's perfectly fine. When we finish the next slide, I will let you know when it is okay to start looking at the slides again. So with that, if we could go to the next slide, please. So this is our ICU, and this is where we do our procedures. You see all the healthcare workers are gowned up in protective equipment. And if you press the next button, please. Next. And next, please. So this is our patient, Ms. H. For now, we'll call her that. She's a young 40-year-old. that came to us after her daughter was sick for a week. She didn't think much of it. She didn't have many comorbidities, so she thought, even this is COVID, it's going to be okay. And when she came to us, she was very sick. She could not breathe on her own. We put her on the breathing machine. And as you can see, the tube's down in her neck now because we couldn't have her breathe from the mouth tube for long periods of time. Incidentally, her kidneys and heart were in a lot of trouble. The team worked 24/7. And for the past 48 hours, we saw what was an improvement. And some of you who have heard the story from me of my patient, I was hopeful for her as of this morning, but unfortunately, she expired this morning. So it's a very hard thing for the team on the front lines. But we couldn't save her. And then the next patient, if you click the next button, please, is Mr. R. And he's our gentleman. He's a veteran, was teaching basketball in his free time. And he was really a remarkable person. Even when he was short of breath, he was making jokes, and you could see he was full of life. With him, we believe it was a household contact. That was the son that was sick for a few days, and then he got sick. Unfortunately, with Mr. R, we did not have much time at all. Within hours, he is no more with us. I know these are stories of sadness, but we have stories of success too. But these are the people that are not with us anymore to tell their stories. We did have a 28-year-old patient who was pregnant and was on her heart stopped after she gave birth, and we had to put her on a full support of her heart and lungs. She was with us for weeks, and she was able to walk out of here. But if we were to reach a stage where we did not have the luxury of these resources, she wouldn't make it either. So these are some of the stories. These are just a small portion of what we see day to day. The common theme of all this is that you, as our leaders today, have visuals on ground zero. This is the battlefield. This is what your soldiers on the front line are seeing, and we wanted you to see this. The data might lag behind. You heard the data story being beautifully told. We have seen it's in front of us, but I'm showing you perhaps what you may end up seeing, and the data might lag behind a few days. That's my hope in showing you what we are seeing on the front lines today. And to all the community members as well, there are very few times where we can actually show and thank you for the family members who made this happen, to be able to share some of their stories from the front lines. From there, we'll move on to the next slide, please. This is a good visual of where the science is today. And I think we at large as a scientific community have gone through a huge learning curve, like Dr. Lockwood pointed, that the amount of data growth has been exponential. And even in healthcare for us, it's hard to keep up. So what I'm showing you is a condensation of probably 100 papers put together. So what it's basically saying is that today we have the technology to be able to say, if you're an infected but asymptomatic person, you cough, talk, or sing, these are the size of the particles that expel and the amount of particles that come out of your mouth. And the person in front of you whom you're interacting with will have a maximum exposure if they're not wearing a mask, and this person will have minimum exposure. Now, the scenario is better if the source or the infected person is actually wearing a mask. Then you can see the amount of these tiny dots actually decreases. And this makes the person, both people who are wearing the mask, especially the one that's wearing the mask, who's a healthy person, minimal exposure. And we'll move on to the next slide, please. And somebody very intelligent asked me this question a few days ago. And they asked me, do we have data from the United States about mask mandates? And as an epidemiologist, we say, in God we trust, but everybody else must bring data. So I thought that was a very smart question. So I started looking at the data that's available. And here is the data that's presented in a table format. And on the left-hand side, you will see that number of days since the mask mandates and what % decrease in the daily COVID case rate would you see. So as you can see, within 5 days, it was less than 1%. Within 10 days, marginally, 1.1. 11 to 15 days, 1.4. And more than 21 days, 2% decrease in the COVID rate. If you go to the next. And this is, I think, graphically well represented. If you see that this was before the mask mandate, and then after the mask mandate, it's a trend. It's not exponent. It's not like a super, obvious trend, but you can see it's trending down. And then when you use a actual cumulative population and multiply by that, not again a direct one-to-one comparison. If you press the next button, please, you can see that this study estimated that about 230,000 to 450,000 cases were averted by the mask mandates. And I think the point to some of the people who spoke ahead of time in the public comments section is that this is the true data. This is kind of a natural experiment that happened in the United States based on different timings from different states of mask mandates. And the mask mandates are also very varied. They talk about accommodation for disabilities, accommodation for medical problems, possibility of being able to wear a mask, and sensitivity to the mask. So there are a lot of different variations of how this was implemented. And if we could go to the next slide, please. And this is our data. I think this was asked earlier in the call. Thank you for asking the question. So we had similar questions in terms of what's actually happening in our community. And thanks to Dr. Jason Wilson, Dr. Oxner, and Dr. Sinnott, with their help, we were able to come up with this data. And we actually asked our patients who come for testing, who come for admissions, and asked, what have you been doing to protect yourself? And interestingly, this is a representation of all our COVID-19 patients, positive patients. And as you can see, majority of them did do hand washing. They tried to do social distancing when they could. The one thing that they did not do was wear masks. Only 12.5% reported wearing a mask versus doing all the other recommended measures. And the next slide, please. This again is the same data set, and here you can see people who wore masks versus those who didn't wear masks. And this is what Dr. Jason Wilson was trying to allude to, is that people who wore masks, you only saw 23% of them being COVID positive, versus when they didn't wear masks, 87% were COVID positive. And next slide, please. I took this picture on rounds a few days ago with the help of our ICU colleagues. And this is a nurse inside one of our COVID rooms, and she was reminding the team to wear a mask while we walk into the rooms, make sure it's fitted properly. I thought this would be a beautiful representation of the voices from inside the field, telling our communities that, we go to battle each day. We can't really control the risks we are in, or we don't know how our days are going to go, what we'll be exposed to. We do our best. We wear all the right PPE and we take care of everybody. But we go to do this every day because we know that our community leaders and our communities will support us in this fight against the invisible enemy, whatever it takes. So thank you for giving us, giving me and our healthcare workers a chance to talk about the stories. And I'm open to any questions.
Dr. Lashmi, thank you so very much. We appreciate your presentation. Commissioner Overman, you recognize.
Thank you. Just a quick question, and I'm not sure who should answer the question. It might be Dr. Wilson, maybe Dr. Lashmi, because of your infectious disease experience. We have individuals that don't feel like they can wear a mask for whatever reason. And so, is there an alternative for that individual who feels just they can't? Can they wear a face shield or a face hood, or is there something else someone can do that has to be out around people that help them besides wash their hands and social distance, which we've seen doesn't do at all? So is there any recommendations, or is there any research on face hoods that might be assistant for those people who can't wear masks? Thank you.
So thank you. That's a great question, and something we feel in the healthcare field, so I can speak to it from that perspective. There are different kind of intolerances to masks. One that is just the inability to keep the mask on versus some of the COPD patients, etc. So that's a different story. There's also a side where there are people that have allergies to the materials that are used. So for those kind of questions, we definitely have masks that are less allergenic, different material, sometimes just a different cloth material, just like any other allergy. So that's usually a simple enough help. And most people are relieved to find out that they're not permanently allergic to all these materials, and it's just a different type that they need to use. In terms of medical conditions, that there is actually a quite nicely laid out instances where it is hard for somebody to keep the mask on, depending on the medical condition. And some of those, there are abilities to use masks for certain periods of time, but not others. But it's very individualistic, and that's a decision they have to make with their doctor.
Commissioner Holman, answer your question.
Yeah, thank you very, very much. And thanks to all the speakers today. You've really been very helpful and very informative. I appreciate it. Thank you.
Mr. Merrill, you're recognized.
Thank you, Mr. Chair. I also wanted to share that I received an email just yesterday from a lady who wanted everyone to know on the EPG that there are also individuals who have an emotional disability related to wearing face coverings and masks, in addition to the physical disabilities or physical challenges. So I wanted to introduce that into the record. She did email me a couple of times, and she said she was not able to get into the public queue, but it's something that you need to take into account as well.
Thank you, Mr. Merrill. I don't see any more questions. So Dr. Latchme, thank you so very much for your presentation. I'm sorry, Ms. Snively, you recognized.
Thank you, Chair, and thank you, Doctor. I had a question back on, I think it was slide 5, where it showed the 2 bar graphs with it was the COVID-19 positive based on reported mask usage. And it showed 12.5% wore mask, and then 87.5% used other methods like hand washing and social distancing. My question was, of the 12.5%, did they report that they only wore a mask, or that it was in conjunction with hand washing and social distancing?
Thank you. And this was data collected throughout. And Dr. Wilson, please speak up. So the ones that the patients that I interviewed, it was the question was, how often do you wear masks? Sometimes, rarely, never. So the people who said never is the one that we included in the 12.5%. Those who said we sometimes used a mask, we still put them in the other section.
Okay, I just, from the data and the research that I've seen between the World Health Organization and the Department of Health, it seems as if it's more of a 3 or 4 pronged approach, not just wearing a mask. It seems like it's in addition to hand washing and social distancing or avoiding crowds, that all of those components really need to be in place, not just wearing a mask. Am I accurate in that statement? Or, I look at it, the analogy I use is kind of like someone who is wanting to be fit, just focusing on exercise and not considering diet and nutrition. They'll eventually, they might eventually improve their fitness, but not to the degree where they would be completely fit, because they're ignoring 2 other significant components of the 3-pronged approach.
No, you're absolutely right. And I'm going to say, and Jason, please comment, this is very early data, right? So this is what we're seeing up front. So we're still collecting more data. I completely agree that all of our infection control practices are usually bundled together. This just kind of is a deep dive into a piece of it. So, but I absolutely agree. It's something we have to do collectively together. Jason?
Member Snively, I think your point is well taken. When we think about how to combat spread and mitigation of virus, we think about trying to utilize multiple public health approaches. And then we try to weigh anytime in medicine, we try to weigh what the harm versus the benefit is of that applied intervention. And so we already know that hand washing, for example, decreases the reproductive rate or the spread of virus significantly, almost as much as social distancing where we stayed safer at home. I mean, that alone was pretty powerful. Now, what we can do is start to, as we get more data, add in how much each different intervention allows us to decrease that R naught we've heard before, that reproductive rate of the virus, and each intervention has its own ability to decrease that. Now, each intervention also has its own impact associated with it. So obviously, staying at home has a huge impact associated with it, it's like chemotherapy, right? It's going to cause some harm. Washing your hands doesn't cause anybody harm and has a huge benefit. What we've learned is that even if we do things like wash our hands and try to stay far apart from each other, even in that group of people who are trying to do that, the ones who wore a mask decrease their chance of catching virus even more so. So I think what we're starting to see from that picture of our data is that we have an intervention measure that's essentially cheap or free. And I think the city and county are trying to make it free for our citizens. Really doesn't cause any harm, where we definitely see a decrease in R naught on top of that decrease we'd already get from other interventions.
Okay, thank you very much, Dr. Wilson.
Okay, I see no more questions. Thank you all for your presentations today. We truly appreciate all the information you've given, and stay safe. Thank you very much. We'll now move to the county attorney's update and the presentation of the draft ordinance. Ms. Beck.
Yes, good afternoon, EPG board members and Chair Miller. This is Christine Beck, county attorney. At last Thursday's meeting, I was directed to bring back a draft order on face coverings for your consideration that would address both employees and patrons of businesses within Hillsborough County. Based on that direction, I distributed a draft order, which is part of your backup, that was distributed on Saturday afternoon. And the draft order, in summary, applies to both employees and patrons of businesses. And it puts the burden of enforcement to the greatest extent possible on businesses so as to minimize the impact on law enforcement. Paragraph 6 of the draft order clarifies that it is limited to indoor locations of a business that is open to the public, and that the face covering is required when social distancing from others cannot be maintained, excluding family or household members. Paragraph 7 states that the business is responsible for ensuring compliance, and paragraph 9 lists several exceptions, and we tried to make this consistent with other local jurisdictions. Paragraph 11 provides that cities may be more stringent. We, of course, did our best to capture the spirit and intent of your discussion last week. I have received some additional input and possible amendments to the draft that I would like to share. One comment was that our current draft has exceptions for children under 2 years old, and this is consistent with CDC guidelines. However, we have seen other orders in other communities deem that an age such as 6 years old or 10 years old may be more appropriate. So that is certainly something you could consider. A second one would be, as we drafted the ordinance so that it could be enforced against both businesses and individuals, this order could easily be amended to only be enforceable against businesses, such that individuals could not be charged with a violation of the order, in order, again, to lessen or further lessen the impact on law enforcement. As drafted, the ordinance requires business operators and building owners to ensure compliance. This is another aspect of the order that could be amended to only apply to the business operators, and the reference to building owners could be deleted. And lastly, there is certainly the opportunity if you directed us to add a provision that would require that the order be reviewed and reconsidered after some period of time as directed by this body. With that, I will be available for questions on the draft and any of the other documents we submitted.
Okay. Before we get to the hands I see, let me say this. We all agree that face coverings work, and they're the only effective means to protect the public health and protection of the economy and the people of this county. If you already wear a face covering when you can't social distance, then you don't have to worry about this executive order to do so. You're already doing that. If you have a physical disability or emotional disability that keeps you from wearing a face mask covering, and I think that's outlined in there. Mr. Merrill just talked about other ones that we need to address probably here, then you do not have to worry about this executive order to do so. If you're not wearing a face covering when you can't social distance, then you need this executive order. Believe me, you do need this executive order. You've heard everything that came from the doctors today, and you would need this executive order. Also, on Saturday, I understand, and I didn't see this, that the Florida Department of Health issued a public health advisory on Saturday in response to the increase in the COVID-19 cases. And the advisory provides a recommendation that all Floridians, individuals in Florida, should wear a mask in any setting where social distancing is not possible, unless the other ones that we already talked about, children under 3 years old, individuals having medical conditions or disabilities, things along those lines. So the Florida Department of Health even now says that it is vitally important that we wear some type of face coverings. So I just wanted to put that out there before everyone starts talking and I didn't have a chance to say anything. I know how that goes. First hand I saw was Commissioner Overman. Commissioner Overman, you recognize.
Thank you, Chair. And I really want to thank all the fellow members of the EPG for giving us the opportunity to talk about this item today. We talked about it before, and I wasn't sure it was coming back, but I really appreciate you taking the consideration. Like the rest of you, I'm getting the same flood of emails and calls, both for and against face coverings, and I understand that this has turned into a polarizing issue. But our numbers are increasing, and we need to take as many of the precautions that we can possibly do to limit the spread of this disease. I thank the many medical professionals that spoke today, and they gave us compelling information that help us recognize the value of face coverings to not only help our citizens, but to help our economy by limiting the impacts of the disease on our citizens and our healthcare facilities. If you're a worker and you get exposed or get notified you're exposed, you're not only out for 14 days, but you may be unable to work for 3 or 4 weeks. And that hurts not only that person and their family, but that business owner too. The number of deaths and hospitalizations are clearly important factors in our decision. And I would note that serious implications that a positive case can have on a business, regardless of the severity of the disease. What we saw this weekend are 2 businesses that had just reopened, and they ended up having to shut their doors because one of their employees had been notified they had come in contact with someone that had been tested positive. So out of abundance of caution, a business that's been around for 40 years had to shut its doors temporarily until we get a handle on how to contain this spread. These are real strains on our economy. And I don't want to lose any more restaurants or retail businesses or support services that we need to help get our economy back on track. If we utilize these tools, we can get on the other side of this tsunami and get back to building our economy. I hope we can focus on the preventative measures, and I hope that face coverings is one of the best preventative measures that we can support. We've been recommending it for months, but it sounds like given the amount of people that are now testing positive, and the amount of spread and the burden that it's occurring in our hospitals, it's time for us to really consider how we can be part of the solution. And I hope we can do that. This order is a pretty fair compromise. It can have a measurable impact on our residents' health and safety, as well as our businesses. It is limited, from what I understand, it's limited to indoors, and it does have the exceptions for those that are unable to wear a mask and to allow those that can assure social distancing. So I'm pretty happy with how this has come forward. Nor would it mandate those businesses that do not interact in public. So if you don't have clients to come see you or customers coming in, it wouldn't harm your business or cause you to do anything different. So I hope that we can move forward on this today. I hope that the staff in this effort, who's been working so hard, can make sure that businesses and individuals have ample face coverings to help keep our community and our businesses safe. And I anticipate that, with our law enforcement efforts, there's going to be a lot of questions. Who does enforcement? Who do I call? What do we do? If our law enforcement officers are supplied with masks to be able to educate people about the value of it, we can avoid legal consequences for those that find themselves without them. But I think it's important that we do need to move forward. And it sounds like, based on the medical appearances we had today, the time is of the essence. And I look forward to having a robust conversation on how we can do this. And I'll stop there.
Commissioner Merman, you recognize.
Thank you, Mr. Chair. Thank you, Commissioner Overman. I think we're where we were the last Thursday, and I kind of followed up and said, I'll second your motion when you move to approve this. I do think there need to be a few changes. I do like the language in there. Christine, Beck, is the language in there that this would be a part of our emergency order that we re-up every Thursday? So would this be reapproved as part of this every Thursday?
Commissioner Merman, it's not currently drafted that way, but that was one of the items I was saying that you could discuss today and give us direction on what you would like, whether you wanted it to be reviewed on a date certain, or if you wanted it to be reviewed on a weekly basis in accordance with the extension of the local emergency order. Any of those things we can easily add to the order at your direction.
Okay, well, most of the other counties, in looking at them, all do this under their emergency orders, except for one. But I think, and it just stays effective with their emergency orders. So I think that's how we should handle it. I don't know what that language would be, but I'd like to see that inserted in here so that we just stay on top of this and it's part of what we do. Also, I would like to see the part taken out, the last sentence on number 14 about the violation and the second-degree misdemeanor. I don't think it's necessary to have that in there, and I will listen to the other discussions, but I do feel that we've got a good order, good language in here, and I think we have enough we can move forward without having any kind of punishment in it at this time. So that would be the two changes I would like to recommend. Also, I do think this has caught the governor's attention. He is going to step up enforcement of social distancing. He says he's leaving it up to local communities on the wearing of mask policy. Of course, the Florida Department of Health issued their public health advisory, and we were told that earlier. This is really a public health crisis. And I have seen the emails that have come to our offices, as Commissioner Overman and Commissioner Miller have, and I do sympathize with them. But We have to worry as public officials about the health of our citizens and when there is a crisis situation. I think the data presented today was compelling. And if we were in a court of law, we would have presented the case to make our decision to have a face mask wearing policy. I do think that we have a personal responsibility to protect others and ourselves and our families. And we do not want to see, this is a prevention measure because we don't want to see what happened when this outbreak first started, where our jobs and the economy was so negatively impacted. And I don't want to see that happen again. And I think we've heard many good phrases today, stemming the tide. It's just, we have to manage this COVID crisis right now. And there are other emergencies in our community, but we need to act on this today. Those are the two changes. Those are my comments. And I want to thank you all. And I hope that you'll feel as strongly about this. When I was out in the community this weekend, I do live in the city, and I asked people when I went to the store, grocery store, when I went places, how do you feel? They didn't have a problem. I never talked to one person. And Commissioner Miller, I think you'd be proud. People in Publix are all wearing their masks. I felt much better than I have had in weeks. But I do think there's quite a bit of evidence now to support this policy and reduce the spread of this disease. And of course, our mayor has already taken the steps in the city. I think it's up to us now to act appropriately. Thank you all very much. And I will second.
Okay, thank you. Well, hold on. We don't have a motion yet. We don't have a motion yet. And this is what I think the best way to do this is this way. We have a draft ordinance, a draft emergency policy executive order before us. Before we make a motion to approve the document, I think what we need to do is, if there are motions to remove or add things to the document, I think we need to get those satisfied first and foremost. So Ms. Beth can have a directive. And then once we've done all of that, we can then make a motion to approve the entire document in totality. Okay. I think that's probably the best way to do that. Okay.
Okay. Then can I make my motions?
You can make your motions now.
Okay. So I move that we incorporate the mask wearing, it's the requiring the wearing of protective face coverings be incorporated into our emergency policy order.
No. That's what I'm saying. You're not making a motion to approve the entire document.
No. I'm making a motion that we put that part in where it's approved, that we actually put the mask wearing policy into our emergency order.
All right.
So it's approved.
I'll second that.
Okay, we have a motion by Commissioner Merman, second by Commissioner Overman. Is there a discussion on that amendment? Since some hands were up, if you have a discussion, just let me know if you have discussion on that amendment. Anyone?
I think Mayor Lott has his hand up.
No, Mayor Lott's hand has been up the entire while. I'm asking if you have a discussion on that particular amendment.
Yes.
Say something. Leave your hands up. Say something.
Yes.
Yes. Who's that? Mayor Lott?
Yes.
So you recognize.
Since we're taking this one by one, I'm glad we're taking it one by one, because I believe at the end of the day we'll know exactly what the draft order is. Okay, because I think what's troubling is that if we vote on something today and all of a sudden all of us go out and we started communicating to our communities and we have conflicting stories on what this draft order is. I don't like mandates, and everyone knows that. Okay, I'm going to be very clear with that. But I do want to say on this particular issue here, incorporating it into our emergency order means that this is in perpetuity until we end the emergency. Okay, and so I'm not for that, because I think that this should be a separate order so that it stands on its 2 feet. And let's say in a week, 2 weeks, 3 weeks, the numbers dive down dramatically. Okay, then there's no reason for leave the mask in order. If we leave it like it is right now, and let's say this emergency is around for 6, 7, 8 months, at least the way I understand this particular motion, that means you have mandatory masks in place for 6, 7, 8 months. And I don't think that's the intent there of Commissioner Merman. At least I hope it's not, and or the rest of this board. Okay. So I would not support this.
Can I respond, Mr. Chair?
Yes, Commissioner Merman, you can.
Thank you, Mayor Lott. Yes, that is clarification. By putting it into the emergency order, it would be in front of us every Thursday. So if we felt a need to take it out, it could be done then. Because you can amend the emergency order when we have to reapprove that. And we could take it out. That's the only reason I want it in there. And you know, I don't like mandates either. But I wanted to give us the flexibility to take it out if and when possible, and not have to do it as a separate action. But that was my only reason for doing it.
Commissioner Merman, can I recommend that it states a separate order, and that as it states, it begins this Thursday, then every 7 or every 14 days, whichever one you prefer, okay, we'd have to renew it. That way it's completely separate from the actual emergency order. Is that okay?
That's fine. We can do it either way. That just means every Thursday we have to approve 2 emergency orders, one for the face coverings and one for our emergency group for the state of emergency.
Right.
Yeah, I mean, I don't mind. It can be a separate order.
Well, then, Commissioner Merman, you need to withdraw your motion and restate your another motion.
I do. So I'll remove that motion and then make the motion to the executive order requiring the wearing of protective face coverings that would be reapproved every 7 days by the emergency policy group in conjunction with the renewal of the state of emergency order. Point of
Is there a second? Is there a second? Is there a second?
All this means is we're going to have a separate order for face coverings. It would not be incorporated.
Is there a second at all on this? Okay, Commissioner Merman, your motion dies for lack of a second.
So we're back on the emergency, we're back on the state of emergency order. So we just have to put the sentence in there that this would have to be reapproved every 7 days. In the emergency policy order for the state of emergency, in the emergency, yes.
Is there a second to that motion?
Well, that's what Overman seconded last time.
I think, are we going back to your original motion?
Okay, hold up. The first motion she made, you second. That's the one Commissioner Lott had a problem with. Mayor Lott had a problem with. She then withdrew that motion, and I thought she made the motion that Mayor Lott wanted.
Yes, I did.
But there was no second to that motion, so it died. So she's now making the original motion she made, which you second, Commissioner Overman.
Right, and my question, I was going to comment on the second motion that
hold up. Before you make any comments, she's made another motion now. We got to get a second before there's any comments. So my question again.
I'll second it for conversation.
Okay. Now, there's a second. Now, Commissioner Overman, you recognize.
Thank you. I did not second the previous motion because my concern is we are dealing with a public health emergency. It seems strange to me that if the numbers get better because we enforce a face covering order, it's because we enforced a face covering order and it was working. It's kind of like taking blood pressure medicine and your blood pressure goes down and gets great, so you stop taking blood pressure medicine. I'm concerned if we have to revisit this that is so difficult to do every 7 days, we may preempt the progress that's made by putting it in place in the first place. So I would prefer it stays as part of the emergency, and then if we find that we either have a vaccine or we have more people voluntarily doing that without necessarily putting the onus on our businesses, that we could rescind it, that element of it at any time. But having it be part of the emergency order was why I seconded the first order and not the second.
And Commissioner Overman, I'm not the sharpest knife in the drawer. Don't pretend to be, but I think that's what Commissioner Merman's motion does. Am I correct, Commissioner Merman?
Correct. Okay. I was trying to be a team player here with Mayor Lott and help him get to a good place where he wants to be to help possibly approve this.
Okay.
I'll second the order.
Okay. Mayor Ross, you recognize.
Thank you, Commissioner. I know we have a motion on the table. I'm just trying to simplify this. There's a couple things that I cannot support on here, but I know we're only talking about the expiration date. Why don't we just simplify this and make this order expire on July 13th unless we renew it? That's 2 weeks from Monday. And that makes the order in effect for 19 days. If it has an effect on the spread of the virus in 19 days, we can renew it. If it doesn't, it expires. Very simple.
Okay. Commissioner Merman, I see you waving your hand.
Actually, that's what I did in the second motion, except I said you had to reapprove it every 7 days. Mayor Lott, that's what Mayor Lott wanted, was that it be separated from that. And that's what I was trying to do. So I think we just have to decide which way do we want to go? Do we want to be in the state of emergency order or do we want to be separate? And you sound like you want to be separate, Mayor Ross. Oh, I just called you Mayor.
Yes, ma'am. Yes, ma'am. I do want
You're the mayor to me.
Thank you. Yes, ma'am. I do agree to be separate.
You want to be separate. Okay.
All right. We have a motion on the floor by Commissioner Merman, second by Commissioner Overman. Is there any further discussion on the motion? If you do on this motion, wave your hand so I can see you, because I know some hands are up because of other things. Is there any further discussion on the motion that was made by Commissioner Merman, seconded by Commissioner Overman?
I really.
Mayor Lott has a comment, Commissioner.
Yeah, Mayor Lott is waving.
Mayor Lott, you recognize? Mayor Lott?
Thank you. I want to make sure I understand what this motion is. The motion is that it becomes a part of the current emergency order, and when we reauthorize the emergency order every week, it automatically renews with the emergency order. And if that's the case, I can't support that. And the reason why is that we're showing our public that we're intending on having an order in place. At least that's the intent of having an order in place until, I just heard a while ago, vaccine or some other numbers, okay? And I think if we are going to do this, then we have to take the time, if it's every 2 weeks or 3 weeks or every week, whatever that case be, and base it on data and prove to the public that the data shows that they should be going through the effort of wearing a mask, okay? And I also hope that when we do this, I'd like to hear one time an opposing view. But anyhow,
I'm going to withdraw my motion
right now.
I'm going to withdraw my motion. I'm going back to the one that supports Mayor Lott. I don't support it being in the emergency order. I'm sorry. I should have stuck with the second one to begin with.
Commissioner Merman withdraws her motion. So what is anyone's pleasure? Is there any other?
I move to make the motion that we have a separate policy for the wearing of protective face coverings that would be renewed every week alongside the state of emergency order.
Is there a
And that's
second?
my
Is there a second? Is there a second?
I second it.
Thank you, Commissioner Mayor Lott. I think that's what you wanted, sir. Is there any other discussion on the motion by Commissioner Merman, second by Mayor Lott? Is there any further discussion?
Mayor Ross has his hand waving.
Mayor Ross, you recognize.
Thank you, Commissioner. And I feel for you, sir. I know this is an awkward trying to get through all of this. I can't support this order the way it's drafted. And Christine and I have talked about this. However, there's a couple of minor, I think, relatively minor changes that if they were agreeable to the rest of the group, I could then support this. And let me explain. In sections, paragraphs 6, 7, and 8, and Christine knows what I'm talking about, I would like to redo those paragraphs primarily, well, there are a couple of reasons, but primarily because I cannot do this in good faith to our police. I cannot charge our police with becoming the mask police. They have enough problems on their hands right now with everything going on without our police department having to respond to complaints of somebody shopping in aisle 8 of the grocery store when they're not wearing a mask. And we're going to get tons of those complaints. But there's a simple fix. If we just retool it to say in this order that it's required of every business operator that fits into this category, that's not one of the exempted categories, that it's required by every non-exempted business operator to require masks to receive services or allow people into their premise. That puts the onus on the store manager. So if somebody calls the police and complains about somebody shopping in aisle 8 without a mask, the police response is you shouldn't need to go talk to the store manager. But it does have teeth, because if you get a bar or you get a business that's just completely ignoring this, and you get a complaint that says, you know, Joe's Bar down the road is letting anybody in, they're not requiring masks at all, then the police have to go deal with the operator of Joe's Bar. But that volume of calls is much, much less than having our police. It's a very simple fix. The other thing that I really it's been addressed in a certain way, I would like to put a date dead certain that this sunsets unless we renew it. I suggest July 13th because that's probably the shortest period of time that we can do it and still get usable data. And if it's not doing anything medically, it dies on July 13th, and I probably wouldn't support it again. But if it does show a change in the curve, we're free to renew it again for another 14 days if we need to. And those two changes, there's other things I could suggest, but those two changes, for me to support it, they really have to be in there. I can't in good faith support this.
Okay. Now, Mayor Ross, you brought up one that we're not discussing yet, and that's the one on the numbers 7, 6, 7, 8, or 6, 7, 8. We'll have to come back to that. The one we're on now is one that Commissioner Merman, motion that was made that you have a concern about, that you say you would like to see it expire on July 13th. Am I correct? Is that what you said?
Yes, sir, that's correct.
Okay. So now the motion that Commissioner Merman has made, you're going to make an amendment to that amendment. What are you going to do?
The current.
First thing I'm going to do is ask her to restate it so I'm sure I understand it correctly.
Okay.
Commissioner Merman, restate your motion.
I can, and I'll tell them just before I restate it that this expires every 7 days unless we reauthorize it. But what it does say is that we would have an executive order of the Hillsborough County Emergency Policy Group requiring the wearing of protective face coverings that would be subject to reapproval every 7 days in conjunction with the reapproval of the state of emergency order. They're not together, they're separate, but we would entertain motions to approve each of them every 7 days.
Okay, Commissioner Miller, I'm not sure procedurally, but the reason that I have concerns about this is not the 7-day part. It's the language that says we're going to put this in place. I don't know if I'm going to vote to put this in place yet because we haven't been talking about the other parts. So I don't have a problem with the 7-day thing, but I do have a problem with the language that says we're going to put this in place and then renew it every 7 days. I don't want to tacitly approve this because I have very serious concerns about the other parts of this.
We're not.
No. Mayor Ross, what I'm doing is this, and that's why I said early on, we're going to take whatever parts of this draft that you all want to discuss or change now, so we can get everything in place. And if we get everything in place and everyone can agree to, then we have a motion to approve the executive order as is. That's why we're taking what Commissioner Merman brings up now. We can come back to you to talk about the items that you had concerning 6, 7, 8. We can come back to whomever has something else they want to talk about. Then once we get that in place, then we will talk about passing the order as amended. You follow me?
Yes, I do. I'm good now. That a little clarity on it. Thank you.
Okay. All right. Okay. Is there anyone else who would like to speak to Commissioner Merman's amendment to the order, the draft order? Anyone else? Anyone else? Okay, please call the roll on Commissioner Merman's amendment and seconded by Commissioner Overman. I think it was Overman? Oh, Mayor Lott. Mayor Lott's second.
Miller?
Yes.
Overman?
Yes.
Merman?
Yes.
Cronister?
Yes.
Castor?
Yes.
Ross?
Yes.
Lott?
Yes.
Snively?
Yes.
Motion carried 8-0.
Now, the next hand I saw was from Mayor Lott. Mayor Lott, you recognize.
Thank you very much. And again, I'm like, Mayor Ross here. I'm not saying I'm for this yet. We have a lot of things we got to get through here, but I just want to kind of go through a little bit of a list here. It's not long, but the first thing I want is clarification from Christine Beck, our county attorney. Christine, are you there?
Yes, sir.
Okay, thank you. Before we get into these items here, I just want to know the listening public to know that I've read every one of your emails. I'm sure everyone else did too. I've taken the phone calls that you called, and today I've had 4 virtual meetings along with some on Friday, taking your concerns, and I'm sure we all have done that because everyone's putting their due diligence and trying to make sure that we come to some conclusion that is beneficial to our county. Okay, so Christine, we talk about businesses, in this order. Okay, but I know that this order does not include churches and nonprofits and other organizations. Is that true?
Yes, sir. Because this order is targeted at businesses and the businesses are defined, therefore this order would not be applicable in any way to religious services, not-for-profits, private clubs, frankly, anything that's not a business.
Okay. Is there any way we can just spell that out just a little bit more clear if this is proved today, just so it says it does not include churches and not-for-profits, religious services, and so forth? That way there's I think the more you spell this out, the less, misinformation reaches out to the field. If you could, I'd appreciate that. Another item here is it's an issue that I know that Mayor Ross has from listening to him here today.
Mayor Lott, hold on. Before you go to that one, I think Miss Beck, would you like to address what the first one that Mayor Lott just said further?
Yes, we absolutely can add language that articulates what is not covered and try to capture that as broadly as possible.
Okay, and thank you. And let me repeat this again. We're going to take these one by one.
We got it.
If we don't take them one by one, we're going to have a problem. So, Mayor Lott, you brought up an issue that you want to do that some more businesses. But before you do that, I saw Mr. Merrill hand goes up, so I think he wants to say something. Mr. Merrill, before we come back to Mayor Lott, did you want to say something, Mr. Merrill?
Yes, please. As long as we're talking about to what this applies, I would like the EPG to consider adding public buildings, at least county public buildings. I won't speak for any of the mayors, but I know my employees are very concerned about this, and I want to protect them as well. And so, taking the lead from Mayor Lott, let's be more specific, at least as it relates to the buildings that I oversee. It's up to the cities then to chime in or not, but I've got to protect my employees.
So what you want the county buildings included where, sir?
I just want clarification that the order does apply to county public buildings.
Okay. All right. We'll come back and get that.
Okay.
All right.
Thank you.
Mayor Lott.
Okay. So if that's not really making a change, because that's already in there, it's just spelling everything out. Okay. And
no, sir.
No, sir, it's not. No, no.
I'm sorry.
Go ahead, Ms. Beck.
Yes, thank you, Chair Miller. This order is strictly on businesses, and we were not directed to include anything with regard to public buildings. We certainly can, and it can be very easily done, but that would require a motion at this point.
I'll move that. Commissioner Overman will move that.
Is there a second?
I'll second.
Okay, there's a motion and a second to the information that Mayor Lott brought forth. Mayor Lott, you understand where we are?
I want to ask a question here before we get too deep into it. Okay. I was speaking about those areas that are non-business. Okay, I know government is non-business, but this shouldn't apply to government meetings, or are you saying that it shouldn't include government meetings?
No, we didn't say anything about government meetings. I thought Mr. Merrill said he wanted it to apply to county buildings. He didn't say anything about government meetings.
Okay.
I'm only speaking for my employees who have to interact with the public. You all then can decide for yourselves, but having said that, in public meetings and board meetings, staff are interacting with the public. For example, interacting in terms of signing up for public comment, all kinds of things. It's so to that extent, if there are going to be meetings, physical meetings going forward where my staff are involved and they're having to deal in situations where they can't social distance, I feel strongly that then public who's attending those meetings need to wear masks. I mean, it's not inconsistent with everything we've just heard. So my employees should not be lesser protected than anybody else, whether it's a private business or anybody else. So that's the premise from my request.
And Mr. Merrill, what you're saying right now does not pertain to what the motion is on the floor right now that Mayor Lott's interested in. Am I right?
I think it's a separate motion. You're right.
That's a separate one. Yes, that's separate.
My motion was just spelling out those that are not included in business. Okay, like churches and religious center and so forth. Okay, it was not actually adding additional organizations to being a part of this face mask mandate. Okay.
Right, and what you encompassed in your language was made a motion. You didn't get a chance to make the motion. The motion was made by Commissioner Overman, the second by Commissioner Merman. Okay. Is there any further discussion on that motion? Any further discussion on that motion? Any further discussion on that motion? Please call the roll.
Mayor Castor had her hand up, and Mayor Castor had her hand up, and Ms. Snively had her hand up as well.
Ms. Mayor Castor, recognized.
Thank you, Chair. I just have to state my disagreement with just stipulating the businesses, and then as has brought forward the government buildings, and then our nonprofits, individuals that are going to, the aquarium, the Straz, those locations. And then on top of that, churches are one of the places that bars and churches are the two where they say that the medical field says that you have the most likely chance of transmitting and contracting this virus. So I would be in favor of any public space besides your residence. Thank you.
Okay, Ms. Snively, you had your hand up?
Yes, sir. Thank you. So we are in the process as a school district of developing the plan to reopen the schools. And I would request that until the superintendent and board have finalized their plan, that this does not include or this exempts public schools at this juncture, because this is going to very much complicate what the superintendent's and school board's proposal will be to reopen schools. He has a plan he's presenting tomorrow morning to the school board. We have not made any final decisions yet, but we do have to consider the research around mask coverings with regard to children, as well as making consideration that we are the largest employer in the county. We have 25 to 26,000 employees in the school district, and there are financial considerations to be made as well. So I would ask that the public school system at this juncture would be exempt. Thank you.
So, Ms. Snively, you wanting to have schools included in the motion that's on the floor right now?
If Mayor Lott would accept it as a friendly amendment.
Mayor Lott didn't make a motion that was made by Commissioner Overman and second by Commissioner Merman. And there's no such thing as a friendly amendment, ma'am. So,
apparently not in this group.
There's no such thing as a friendly amendment. You can check Robert's Rules of Order. No such thing as friendly amendment. So, are you wanting to amend the amendment to include schools?
I would like to exempt schools.
So, Ms. Snively is amending the amendment made by Commissioner Overman and Commissioner Merman to include schools. There's second to Commissioner Snively's amendment to the amendment. Is there a second?
I'll second that.
Second by Mayor Ross. Do me a favor, everyone just take your hands down and we'll come back and start doing this all over again. Take your hands down, okay. So we have an amendment to the amendment by Ms. Snively, second by Mayor Ross. Is there anyone wanting to discuss the amendment to the amendment? I hope you all are following where I'm going because I'm going by the book. Is there Commissioner Merman, you recognize?
My only comment is, and it would be easier if we just said in here that the public school facilities will be under separate policy. I mean, I don't know exempting them, but they're going to have their own policies going forward on all this stuff. So I think that should be throughout, even our emergency order, through all of them. But that's my only comment. I mean, I'm going to support the amendment, but I think that's really what her intention is, because I heard her say is that we're going to be discussing our own policy. Is that right, Ms. Snively?
Yes, thank you, Commissioner Merman.
Yeah.
Chair Miller?
Yes.
Yes. If I could just clarify, this is Christine.
Please do.
The order right now is only drafted to cover businesses, and what Mayor Lott was asking is that we make it clearer in the order that it only is covering businesses, and therefore we would add language that it does not apply to religious services, not-for-profits. And the way I understand Ms. Snively's input is that we would simply also add that clarification, because it does not apply to the school system as drafted, and we would simply add that clarification to address that concern and to add that clarity.
Okay, and the motion is in order. Am I correct?
Yeah, as I understood the motion, it was simply to direct us to add clarifying language of what is not included as a business in those items we've been discussing.
That is correct.
Okay. Now, so we have an amendment to the amendment by Ms. Snively, second by, I think, Mayor Lott, I think it was. Commissioner Overman, you recognize.
Thank you. I'm trying to also get clear, because he's looking for churches and nonprofits, correct?
Religious services.
That's fine. But when we talk about nonprofits,
Commissioner Overman, hold up. We're not on that amendment. We're not on that amendment right now.
Okay, all right.
We're on the amendment dealing with the schools.
I'm fine.
Okay?
I'll wait.
We'll come back. Just leave your hand up. So is there any further discussion on the amendment to the amendment made by Ms. Snively, second by Mayor Lott, concerning schools? Hearing none. Call a motion on the amendment to the amendment.
Call the roll.
What I said.
Miller?
Call the roll. Yes.
Overman?
Yes.
Merman?
Yes.
Cronister?
Yes.
Roth?
Yes.
Castor?
Yes.
Lott?
Yes.
Snively?
Yes.
And Chairman Miller, the motion carried 8-0, but I did need clarification because I did note that the motion was seconded by Mayor Roth and you were saying Mayor Lott.
Okay. Ma'am, okay, you got it better than I do because you got it, yeah, Mayor Ross.
Okay, the motion carried 8-0.
Okay, now we're back on the original amendment that was made by Commissioner Overman and second by Commissioner Merman. Commissioner Overman, you want to speak to that motion? Commissioner Overman?
Yes, this puzzle piece is getting interesting. I was trying to discern when we were talking about the last motion regarding, churches, it mentioned nonprofits. And nonprofits in our governmental world is pretty broad. Are we talking about governmental agencies in the sense of our summer programs, all those kinds of things? Or are we talking about charities that are funded by the county? I'm just curious. The definition is very, very broad. And by excluding them, that it creates a very broad category of places that people go to and interact with public. I guess that's my question. So
who wants to answer that question?
Chair Miller, may I try?
Yes, ma'am.
This is Christine. The order defines business as an entity that provides goods or services directly to the public. Therefore, and it actually should say for profit. So it was never intended, never drafted to cover a not-for-profit because that wasn't the direction that we received. And that would provide another broad category. That doesn't mean it's something that we couldn't add later or add today, but right now it is not drafted that way. And the way I understood the motion was to just clarify that this is limited to businesses that provide goods or services to the public for a profit.
Can I ask you a question, Commissioner Overman?
yes, it did. Thank you.
Okay. Is there any other discussion on the motion by Commissioner Overman, seconded by Commissioner Mayor Ross? You recognize?
Thank you, Commissioner. I probably just let it go to a vote and leave it be, but I understand completely what Mayor Lott's trying to do here, and I agree with exempting these. But as you can see from the discussion, it gets thorny and a little complicated. Let's not lose sight of what we're trying to fix. The real problem here is bars and places like that. And so businesses really kind of captures it. This is something we're doing in 7-day increments. And I agree with Mike Merrill. I mean, government buildings, but each of us here already have the power. We already have our buildings locked down. And if we don't, we have the power here to do it. We don't need the EPG to do that for us. We can do it ourselves. So I'm in favor. I mean, I'm not going to hold the works up here by voting no on this, but we could just look at businesses and move on. We're doing something in 7-day increments. It's not perfect, but the only way I can support this ultimately when we get to the big vote is if this is very surgical. I can't support I won't support a very broad thing that requires everybody in every public space to wear a mask. I can't do that. That's not the only way that I can do this. If it's surgical and it's immediately responds to the public health threat. So anyway, I'm okay with leaving it like it is, but if you guys want to add government buildings, and we can do that too.
Okay, now we're not on government buildings yet, Mayor Ross. We're on the motion by Commissioner Overman, second by Commissioner Merman concerning, I think it was churches, not-for-profits, and things on those lines.
Mr. Chairman.
Yes,
okay.
A lot.
I appreciate Mayor Ross's comments there, and I agree with them. The only reason I wanted to do this is because in previous orders we've had, there's been times where we have gone out to the public, not intentionally, okay, and had different messages on what was included and what's not included. And and businesses state what it is. I just wanted us to be really crystal clear, because I would hate for someone start calling on a church, you know, that they're violating a certain order when they originally was not a part of this. So all I'm trying to do is not change the order in paragraph number 1. It's simply to spell it out a little more clear. That way we're all on the same page if this proves passes today. Okay, so that was my intent, not to create anything new, just clarify it. That was it. Thank you very much.
Ms. Beck, can I ask you a question?
Yes, sir.
Does a governor's order that he put in place some time ago already exempt churches from this executive order if we pass it?
The religious services have always been deemed essential under the governor's order. So there were very few limitations, but the governor's orders do not have any requirements about face coverings.
So my question is, does this executive order already cover this, and do we have to put this in this executive order or not?
Well, we really don't have to put it in. The order, I can tell you now without waiver that it is not intended to be applicable to religious services. But I think Mayor Lott's point is simply for ease of the future enforcement. And as we leave this meeting, when people are looking at the order, it might give comfort and clarity to those to be able to see it in writing. And we're happy to do that.
Okay. All right. Seeing no further hands on the amendment, and the amendment also includes not-for-profits, am I correct? I think I remember that. Okay. Please call the roll.
Miller.
No.
Overman.
No.
Merman.
Yes.
Cronister.
Yeah.
I'm sorry, I couldn't hear you.
Yes, ma'am.
Thank you. Castor.
No.
Ross.
Yes.
Lott.
Yes.
Snively.
Yes.
Motion carried 5-3. Chairman Miller, Commissioner Overman, and Mayor Castor voted no.
Okay. Mayor Ross, I think you were next.
Mm-hmm.
Thank you, Commissioner. I think we've solved some of the problems as far as the expiration date and so forth. I really, the big remaining thing for me is that this has to, I'm very concerned about the onus that this is going to put on law enforcement, and this is a terrible time to put something more on them. So I really would like us to, it's really not a major change. It just puts the burden on the operator of the business. The subject of the order is that an operator of a business would have to require face coverings unless they're one of the exemptions, and not the individual. And that does a couple things. One is it keeps law enforcement out of this largely. Now, they'll still have to deal with business operators that fail to comply, but that number is much smaller than the general public. And two is it saves all of us a lot of grief, because there's no chance that anybody in the public can be charged for not wearing a face mask. You can only be charged if you operate a business and you refuse to require a face covering. And so that's a subtle difference in language. It accomplishes much of the same thing, but it is significantly different in terms of enforcement. And so that concerns paragraphs 6, 7, and 8. I've had lots of discussions with Christine about this. So she should be clear on what my position is. And I really feel strongly about this. I mean, I'm willing to compromise on other things, but I don't know that I can compromise on this because I'm very concerned about the effect of our police.
Is that a motion?
So what is your are you making a motion?
Okay, yes, I'll make a motion. Yes, I'll make a motion. Okay, I make a motion that we change paragraphs 6, 7, and 8 to make the subject of this order business operators, that business operators must require face coverings in their premises unless they fall into one of the exempted categories.
I'll second.
No provision for individuals to wear a face mask. It's on the business operators.
I'll second that, and I have a question.
Mr. Okay, hold on. There's a motion by Commissioner, by Mayor Ross, second by Commissioner Overman. Commissioner Overman, you had a question?
I do. I get where you're going with this. It is compelling to the business owners to participate in part of the solution and to work with their customers to help them know that they must wear a face covering when they come into their business. I do believe that it is going to be challenging for the business owner. I'm worried about business owners that are confronted by customers that insist. But Christine Beck, can you confirm that a business owner has the right to tell someone they must wear a mask when they enter into their business? Do they have the legal right to do that so that they can protect themselves when they advise a customer that they're unable to enter their business or take advantage of their services without face covering?
Commissioner Overman, the way I understand Mayor Ross's motion is he is wanting to require that the business operators are required by our order to require the facial coverings and to enforce it. And I could use some clarification. Would that also then result in there could be no individuals charged with the violation of the order, as I understand it, but we would be requiring the business operators to require the facial coverings and to enforce it?
That's correct.
Okay, that answered my question. Thank you.
Mayor Lott, you recognize.
Yes, if I could ask Mayor Ross one thing about his intent. In item number 7 on line 2, where it says business operators and business owners or building owners, my concern there was that there's a lot of building owners that are owned by people out of the state, REITs, corporations. They're not all business owners are operating in that particular facility. I think it'd be very hard to. I have a building in West Shore I haven't been to in probably 2 years. I think that there's multiple companies renting in there, but to hold me, at harm for those operators not operating that facility right, I think is a little bit much. So is there any way you would be willing to amend your motion to exclude building owners? Because an operator covers everybody.
Yes, sir. I completely agree with you. I just thought I was violating the Commissioner's Miller intent to do one thing at a time. But no, I absolutely agree with you. That was going to be another point. If it's not too much, I put into one motion. I will amend the motion to say that the language should be business operators. And we can
let's do it this way. Withdraw your original motion and state a new motion.
Okay, I can do that. So I withdraw my original motion and make a second motion. My revised motion is to make business operators the object of the emergency order and to compel business operators to require face coverings in their businesses unless they fit into one of the exempted categories, and take all language out that requires individuals to wear face masks. The only persons that could be charged under this order would be business operators.
I'll second that again.
Okay. All right, very good. Motion by Mayor Lott, second by Commissioner Overman. Commissioner Merman, you recognize.
Thank you, Mr. Chair. Okay, Vice Mayor Ross, I wanted to, this kind of goes with your motion. I didn't know if you thought about, but in item number 14, it talks about the punishment, the prosecution, and second-degree misdemeanor, which again would be a law enforcement responsibility, which I would like to eliminate. Would you consider that?
Separate motion. Separate motion, ma'am.
Okay.
Separate motion,
That's
Commissioner
an
Merman.
amendment. Okay.
Second
Okay.
motion. Second. We'll do that separately.
Okay.
Ms. Nabby, you recognize.
Thank you, Chair. I have issue with both, actually, as far as mandates go. I think we are already putting undue strain on our law enforcement by mandating something like this. So I'm interested to further discuss Commissioner Merman's recent comments about that. But also, I don't know that we need to punish our business owners by making them the enforcers in this. I mean, that we've already strained our small businesses, small, medium, large businesses quite a bit throughout this COVID pandemic, and to ask them to do one more thing, put yourself in that situation, that very awkward situation where you want to do business. You have people to pay, you have bills to pay, you have overhead to pay. You're trying to employ people, and then someone walks through your door that's not wearing a mask, and you're going to turn that business away and risk that individual chooses not only to not do business with you, but could possibly tell their family and their friends and any other customers that you already have to also not do business with you because you're violating their constitutional rights. So I have a problem with that, because I don't want to put business owners, the thousands of business owners in our county, in that situation where they may have to turn away business and risk losing revenue because now they're becoming the enforcer in this particular situation. So I am not in favor of that. If I had to choose, I would choose law enforcement over making business owners and operators do it. I don't like either, but I'm not going to be able to support that. I think it puts undue strain on business owners that have already been through undue strain through this pandemic. Thank you.
Mayor Castro, you recognize.
Thank you, sir. Just for clarification, I want to go back to the original, what all medical experts said, that we have seen an incredible surge in these cases, and we are going to see additional deaths related to COVID-19 if we don't take a bold step in this. And every single medical expert said the easiest way to do it was to wear a mask. Because the dismantling paragraph by paragraph of this order here, over the weekend, as I stated, we passed out 1,000 masks. You're seeing people wearing masks all over the place. People are going to do what leadership has asked them to do. And we put it in effect Friday. It's now Monday afternoon, and we've had less than a dozen calls to law enforcement about this. So it's not overwhelming law enforcement here in the city of Tampa. That's all, sir.
Okay. We have Mayor Lott, you recognize. Okay. Commissioner Merman, you recognize.
Nope, forgot to put my hand down. Sorry.
Okay. All right. We have a motion by Mayor Ross, second by Commissioner Overman. Seeing no further discussion, please call the roll on the motion.
Miller,
Yes.
Overman,
Yes.
Merman,
Yes.
Protester,
Yes.
Castor,
Yes.
Ross,
Yes.
Lott,
Yes.
Snively.
No.
Motion carried 7-1. Ms. Snively voted no.
Okay. Commissioner Merman, you had something you want to bring up.
I did. Thank you, Mr. Chair. I wanted to remove the last sentence in paragraph 14. It says, however, in the event voluntary compliance is not achieved, then as a last resort, a violation of this order pursuant to the provisions of Section 252.50 Florida statutes may be prosecuted as a second degree misdemeanor punishable as provided Section 775082 or 775083 Florida statutes. I want to remove that from Section 14.
There's a motion by Commissioner Merman. Is there a second? Is there a second?
I'll second it, Rick Lott.
Second by Mayor Lott.
Chair Miller, may I comment when you have a moment?
Yes, ma'am. Go ahead.
Commissioner Merman, if you remove that, then this will be left as in essence, a strong encouragement because it's only seeking voluntary compliance.
I mean, okay, can I respond, please?
Yes, sure.
I feel pretty strongly about this because our sheriff, our Tampa police, and Temple Terrace and Plain City police are having to deal. They have a lot on their plate right now. And I don't think that taking calls for violations is appropriate. But they're going to get called if somebody gets belligerent and out of control and looks like they're a danger to their business or other people. So I think that's just under standard, that's what they do under standard business. I don't think having this here is necessary. That's just how I feel about it.
Okay. Commissioner Overman, you recognize.
Thank you. And I appreciate this. I actually had discussed this with Ms. Beck because I liked the idea of, initially a citation or code enforcement could help, or, something that would actually give a business owner encouragement to do it well, without necessarily the penalties that are required according to our ordinance and according to the state. But I do recognize there's a certain amount of incentive if there is something more than encouragement, because we've been trying to encourage for months. And I'm concerned that if there are no penalties whatsoever, then we're back to square one. I mean, there's no incentive for the business owner to post the sign or to follow the rules. Could basically just say, sorry, I didn't know, and then I'll do something about it. But I think it's important that we send the message that this is critical to the public health of our community. And business owners can be part of the solution. And this gives them further incentive to be part of the solution and to protect themselves from a customer that is actually unable or unwilling to follow the rules. And in this particular case, I'm not sure it's possible for us to eliminate some level of Section 252.5 that suggests that there is a penalty or a punishment. I'd like to open the discussion. If it's possible to do something other than a second degree misdemeanor, I'd be interested in talking about that. But having no consequence means we're going to be right where we are, because of those businesses that post signs to their customers saying, no shirt, no shoes, no mask, are going to continue to do that. Those that aren't going to do anything if we remove any of the consequences. And I'm concerned about that. And I'll leave it there for further discussion.
Okay. Mayor Castor, you recognize.
Thank you, sir. We had consequence for the safer at home, and we didn't have any issues with that. And, it's already been basically watered down based on its effect on law enforcement. And as I said, the whole weekend, and we've had a dozen calls concerning it. That's all, sir.
Chef Cronister, you recognize.
Thank you, Mr. Chair. If we make facial coverings a law, it will overburden and place local law enforcement in a compromising position to enforce. Has anyone considered the secondary effects for our state attorney, public defender, and judiciary who will have to prosecute, defend, and dispose of these cases? If the purpose of this measure is to educate and encourage citizens, why do we need a law to do that? As leaders, I believe this policy group should build upon the concept of rapid response teams that would go into the zip codes with the greatest needs. These teams could focus resources to enhance education on how to prevent transmission, provide that much needed PPE supplies, and strongly encourage adherence to CDC guidelines. I believe wearing facial coverage is an individual responsibility. Here at the Sheriff's Office, I've implemented requirement of wear a mask, but I didn't need government to tell me to do it, and I didn't need it to be someone breaking a law.
Okay. Commissioner Overman, you recognize?
Apologies, I forgot to take my hand down. I apologize.
Okay. All right, so we have a motion on the floor by Commissioner Merman, second by Mayor Lott, to strike the language that she enumerated in section 14 of the draft ordinance. And I see no hands at this time. Mayor Lott, you recognize.
Right. Mayor Ross has his hand raised.
Okay, Mayor Lott has her hands up. I'm calling Mayor Lott first. Mayor Lott, you recognize.
I lowered my hand. I'm fine. I'm ready to vote.
Mayor Castor, you recognize.
Didn't Christine Beck just say if we take the punishment that it isn't an order anymore? So we really don't need to be voting on this.
She basically what it said. She said, I think. Well, I'll let her say what she said. Ms. Beck, you want to repeat what she said?
Yes, Chair Miller. When you remove that language, you're left with simply the intent of the order is to seek voluntary compliance and to educate and warn. So it does become strong encouragement. It would not have an enforcement mechanism.
Right. Mayor Ross, you recognize.
Thank you, Commissioner. And we've kind of come full circle here. I was not a big proponent of this from the start, and unless it was very surgically directed at our specific health problem. But I don't know what benefit, I mean, what was the point in all of this since Thursday if we're going to take if we're just putting out a stronger advisory? We've been saying this all along to everybody. So we aren't changing anything. And if I understand the law correctly, all of our orders are only enforceable as misdemeanors. We don't have to, anything other than that is just an advisory. So really we have no order. If we take this language out, there's nothing. And keep in mind that because of the last motion that passed, individuals, I want the public to understand this clearly, individuals who go out and are not wearing a mask are not subject to anything. However, business owners, if you own a bar and you're not requiring anybody to come inside to socially distance or wear a mask, subject to enforcement. And you know, if you're just blowing this off and you're not requiring social distancing, which would exempt you, you're not requiring masks, you're not requiring any of the protocols, then yes, you would be subject to enforcement. But I don't think those numbers are going to be very big at all. I think most business owners are going to do the right thing and comply. I don't think, like Mayor Castor said, I just don't think that we're going to get tons and tons of people that are just not complying. There'll be a business here or there probably, but they should have to be forced to comply.
Commissioner Overman, you recognize.
Thank you. And I'd like to start Mayor Ross's concept in this. We've had great compliance with the safer at order, and people stayed home for 3 months, and we would not want them to have suffered that for no reason by taking the teeth out of the encouragement, but also consequences of not supporting the effort to reduce the spread. And our business owners have the best opportunity for doing so. And those that are going to not comply are going to not comply and have already become the problem. Our business owners and our citizens have heard for months that social distancing is necessary, that wearing a mask is highly recommended, and we haven't gotten where we needed to go. This order can get us there because it gives the business owner a great incentive to encourage their customers, and it does require their employees, whereas social distancing is not possible, to wear face coverings. And in the scenario that Mayor Ross has given us, it's not possible in a restaurant. It's not possible in a bar. You have to sit to be served and you're able to social distance that way, but it's not possible in those scenarios if the staff isn't wearing a face covering. So I will support keeping that in place. Removing it, I can't support.
Let me say this. If we take that out, we're just right back to the strong encouragement of wearing masks. And that's not where we need to be going. I'm going to repeat myself one more time. Today, we had 393 new cases positive COVID-19 in Hillsborough County. We had, but since last Tuesday, if my numbers are right, 2,012 new cases reported in Hillsborough County. On the national news, they said that Florida and including Hillsborough County will probably now become the epicenter of the COVID-19 in this country. And now we're talking about going back, taking this out and making it a strong recommendation to wear masks. And we just heard from the experts of where this is coming from and what's happening with it. And I just cannot see us sitting here now just making another strong recommendation. If that's the case, our attorneys wasted their time this weekend by doing that. So I'm going to ask that you please keep this in there. It's not on the person anymore. It's on the business owner. It's not on the business, the property owner is on the business owner. And as the mayor said, more than likely, the business owner is going to comply with this. You're going to have one or two businesses out there that just don't give a damn, and they're going to be the ones that get the citation. Okay? So we have a motion by Commissioner Merman.
Hold on.
Second by, pardon me?
I'm
Commissioner Merman, you recognize.
I'm withdrawing my motion.
Commissioner Merman withdraws her motion.
You gave a very good speech.
Thank you. Mayor Lott, you recognize. Mayor Lott?
Thank you, Mr. Chairman. Okay, a couple more items I had here was, and again, all I'm doing here is not adding anything, okay? It's just from a conversation I had with Ms. Beck earlier today, it was just clarifying a couple of items, okay? If we walk through 8A, it says persons under ages of 2, and I do like the idea of increasing that a little bit, but that's not a deal breaker for me, okay? But where it says here, when we starting getting into getting to existing health conditions, okay? Are we talking about asthma, anxiety, certain, disorders that different individuals may have, individuals that have trouble breathing, individuals with COPD, allergies? Is that what we're talking about? I just want to clarify that with Ms. Beck.
Mayor Lott, it simply says that if a person has an impairment due to an existing health condition and because of all of the privacy issues, that would really be on the individual to assert that impairment and make that case, and the order then wouldn't be applicable to them if they're willing to say that.
So in other words, if someone was went up to a business, okay, and that business owner said, I'm not going to let you in because you don't have a mask on. And if that person said, I have one of these conditions, does that business owner still have the ability to say, well, you can't come in anyhow?
Well, I think under his rights as a business owner and, complying with a bunch of other laws, he probably has some discretion there, but it wouldn't be from this order.
Okay. So if someone walked into a grocery store, okay, and they're walking inside the grocery store and another citizen started yelling at them and said, hey, you don't have your face mask on. And they said, I have anxiety. Does that cover that person? Or, I mean, I'm just talking about real life issues here. I mean, I'm just trying to clarify it a little bit.
So I can't say for every factual scenario, but I think if a person was asserting an exception in that manner to the manager of the business or the operator, they would be able to read this order and make an exception for that person. And they don't have to have any documentation or anything like that. There's no requirement.
They don't have to show proof of health or anything like that. Okay.
That's correct. That is not required.
Mr. Merrill, did you want to say something?
Yes, Christine, I shared with you the email from the lady that I spoke about earlier. So you've seen what her issue was. In your opinion, would she be covered, her condition be covered under the existing language?
I think what she described, she could clearly fit into the words and impairment due to an existing health condition, and therefore that should provide an exception for her condition.
Okay, thank you, Christine.
Mayor Lott, you have the floor.
Well, as long as that's very clear, then I don't have a motion at this time on this. Okay, thank you.
Mr. Snively, you're recognized.
Thank you, Chair, and thank you, Mayor Lott, for bringing that up, because I believe in public comment, someone actually referred to this situation as a cause for concern, because now you're forcing individuals to potentially disclose that they have a health condition in order to do business with, a business, to go into a business and have their be a consumer for goods and services. So that could be, and Ms. Beck, I don't know if that's borderline violating federal HIPAA regulations. That's a concern. Then the other piece of that is anybody who doesn't want to wear a mask can basically say, I'm exempt. I have a condition that exempts me. And so that kind of basically makes this pointless, because anybody who's not going to want to wear a mask is going to say that I have a condition that exempts me from wearing a mask. So at this point, I'm still in favor of making this a strong recommendation and thinking outside of the box and maybe thinking about other ways that we can encourage people to wear masks and wash their hands and social distance. It's a three-prong approach. Masks are not the end all, but they do have to be in conjunction with hand washing and social distancing. And so that I have a concern with that, because I don't think people should feel forced to disclose that they have some type of medical condition publicly when it's none of anybody's business if they have a health condition. But they're obviously going to be singled out by the public because they're not wearing a mask. So that's the issue I have with that particular point. Sorry. Thank you.
Commissioner Overman, recognized.
Thank you, Chair. And I think we have to kind of remember from where we've come. For over 30 days, people stayed home and had to find ways to get to services. They ordered groceries from home. And business owners actually, helped people who insisted, those businesses that did require face coverings, offered to help those customers by saying, I'll take your order. I'll do your grocery shopping for you. I'll meet you at the front door for groceries. I'll meet you at the front door with your to-go order. We had communities that were actually, picking up meals at places of businesses and taking it to those individuals that have a health crisis or have a health emergency that would put them in danger of being in public from this virus, should probably are putting themselves at risk by being in that business in the first place. But in this particular case, we can and have found ways that people can do business with business owners without necessarily walking in their door without a mask on. And so I don't believe that's an impediment to solving the problem we're trying to solve. If someone has a health issue and they just say that, I am certain if the business owner realizes they are going to pay a penalty by allowing that person in there inadvertently, they can find a way to help that person get the services they need. And that is the most respectful thing that both the person with the compromise can do and the business owner can also do. So I recognize that they don't necessarily have to disclose what their illness is, but I think there's a problem that can be solved here without necessarily taking that language out and violating HIPAA in the process. So thank you.
Let's bring the same thing in for landing. We've been on this call for 3.5 hours, so let's bring it in for landing now. Mayor Lott, you recognize. Mayor Lott? Commissioner Merman, you recognize.
Yes, quickly. Most business owners got into business because they had common sense, they know their customers, and they exercise very good judgment.
To make a motion on that, would you bring it up again, Mr. Merrill?
Yes, thank you. So this, I guess, Christine, just to clarify, the order as it stands after all the amendments would not apply to government buildings, correct?
That's correct. It's only directed as businesses as defined, and that includes a for-profit business that provides goods or services. If you wanted to add something for public buildings, what would be helpful to know is if that would be all public buildings or just in, if it's limited in some way, and then we would need a motion and a second to add that by an EPG member.
Okay. The second question is whether the, as it currently stands, would it apply to universities, public or private, or an entity like HCC?
No, it would not. Those are typically not for profit.
So I would just simply suggest, my opinion for you to consider. We heard the medical experts talk at length about the age group that's most prolific, I guess that's the right word, which would be the age groups typically in universities and such entities. So I'm not suggesting anything, but just simply to point that out. So that's all I have, Mr. Chair.
Okay, so we don't need anything to cover government buildings or state universities, private universities, or HCC, am I right?
No, we need a motion to cover government buildings.
I'll make that motion.
Whoa.
Mr. Chairman.
Hold on. Is there a motion?
Yes.
Mr. Chairman.
Hold on. Is there a motion? I'm gonna get you, Ms. Lott. Hold on.
I'll make a motion. I'm trying to make the motion.
Well, Commissioner, we have a motion by Commissioner Overman. Who's it seconded by?
Me, Merman.
Commissioner Merman. Ms. Lott, you recognize.
Okay. If I could ask, I think Commissioner Overman is the one that made the motion. Could she amend that to where each government agency could have their own plan? Okay, because I don't think every government agency should be tied into one plan. Okay, we should have the opportunity for each municipality, each agency, school board, and so forth, both to have their own plan what meets that agency's needs and desires. Okay.
I'm going to ask Christine Beck to assist in deciphering that request, please. I mean, what I hear from Mr. Merrill, is that the county buildings and the county employees are very much interested in making sure that masks are worn. And as someone that periodically goes into the county courthouse, there's a clerk's office there and a variety of other reasons, but bottom line, I've been in the courthouse enough to know that I would prefer to see people in there wearing masks. So if there is more clarification about what type of building you're suggesting, are you asking for an exemption by the cities to this rule? And I think we already have that language, or at least more stricter was an option in this order. Ms. Beck, could you help me, please?
Yes. Let me see if I can help. What might be appropriate here would be to add via a motion that the order would also require facial coverings in public areas of government buildings, and then allow the municipalities to opt out if they wanted to.
And that's my motion.
Okay, fair enough. Yeah, you can drop out if you want to.
I'm sorry, say that again?
Then that is my motion, government building.
Well, you gotta withdraw your original motion.
Okay, I'll withdraw the original motion and put the motion forward that of government buildings and Christine help me with the rest of that language. That municipalities could act in public spaces that they were to wear masks, but individual cities could actually make.
Commissioner Murman, still second?
Yes.
Okay.
Yes.
Is there any further discussion on the motion?
I believe Mayor Ross has.
Mayor Ross, you recognize.
Thank you, Commissioner. I'll be brief. I understand what Mike's trying to do, and I fully support him, but I still prefer that we just do this. Everybody sitting on this meeting has the authority to do that already, and we already have. And there's all kinds of unintended consequences to this that we could spend an hour on. So we're telling the judge that he can't tell somebody in his courtroom to take their mask off. What about the federal buildings? What about the FBI building? What about the secret? I mean, I just don't need to go here. The problem is none of that. The problem is the young people are going and packing in. Let's just get this. That's my opinion. I mean, I get the spirit. I understand the spirit of what Mike's trying to do, and I agree. I just think we're opening a whole nother can of worms. Now we got to go through each one of these proposed exemptions, and what about the courtrooms, and what about the, on and on and on.
Okay.
Mr. Chair, if I could just ask Christine, does the Board of County Commissioners have the authority to do what I'm suggesting?
To require masks?
Yes.
Require face coverings?
Yes.
Yes, although if they were going to do that, I guess they could do it by resolution, and they could do that, yes.
Okay. That's fine if that helps resolve this.
Okay, so do we still want this motion?
I don't think we need it.
If we don't need it, then I was under the impression the Board of County Commissioners could not compel the public to wear face coverings in public buildings. But if we can, then that's fine. I don't want to overcomplicate this. I just need to protect my people. But we need to get this done, and so I don't want to throw a wrench in this. But I just want to get that on the record that this is important for people who serve the community.
And I will.
Excuse me. So my understanding from Ms. Beck is that the county commissioners, through resolution, can get to where Mr. Merrill wants to go. Am I correct? Don't you say?
So there is a bit of a nuance, Chair Miller. The county commission by resolution can do it for its own buildings and any county buildings, but if they were going to do it for another government's building.
No, that's not my point. That's not my point. I'm talking about county government buildings.
Yeah, Hillsborough County government buildings, they can do that with the resolution.
Okay, all right. Now, Commissioner Overman, what were we going to say?
Assuming that won't take 6 months, I'll withdraw my motion.
Okay, Commissioner Merman withdraw. Commissioner Overman withdraws on motion. Commissioner Merman, you recognize.
Nope, I'm done. I'm done.
Okay. Is there any other amendments that need to be made to the draft executive order? Going once, going twice. Is there a motion to adopt the executive order?
So moved.
Motion by Commissioner Overman, second by Commissioner Merman to adopt the amended executive order. Seeing no further discussion on the executive order, please call the roll.
Miller,
Yes.
Overman,
Yes.
Merman,
Yes.
Cronister,
No.
Castor,
Yes.
Ross,
Yes.
Lott,
No.
Snively.
No.
Motion carried 5-3. Cronister, Lott, and Snavely voted no.
Thank you.
Okay. Is there anything else we need to discuss today? I hope not.
Chair Miller. Chair Miller, this is Christine.
Yes.
You had asked me to bring up the issue about virtual meetings. Do you still want to do that?
Yes, I do. Yes, I do. I'm sorry. Yes, yes.
Okay. So I just wanted the board to know that the current state of affairs with regard to the governor's orders regarding the allowance of virtual meetings is set to expire on June 30th month. So it's possible in the next 8 days that the governor could extend that, but we did want to bring it to your attention that if it's not extended, you will have to go back to having a physical quorum and public location requirements and so forth. So I believe, Mr. Chair, you may have wanted to take some action with regard to that.
Yes, I do. I've talked to Ms. Beck about that this morning and feel that this board, this body, if we're going to continue to try to do this, it needs to send a letter to the governor asking that he extends that executive order where we can have virtual meetings. So I will pass the gavel to the vice chair, Commissioner Overman, and make a, no, I got to sign the thing. Will somebody else make the motion?
I will make it. Commissioner Overman will make the motion that you send the letter, and then if, in addition to that, well, go ahead.
Okay, is there a second?
I will.
There's a motion by Commissioner Overman, second by Commissioner Merman. Is there further discussion on the motion? Further discussion on the motion? Seeing none, please, Mayor Ross, you're recognized.
No, I had a comment on another item, not the motion.
Okay, all right. Seeing none, please call the roll.
Can you please restate the motion, Chair? I'm sorry.
The motion is that we send a letter to the governor asking him to extend his executive order whereby government bodies can meet virtually, continue to meet virtually.
Thank you very much.
Yeah, please call the roll.
Miller,
Yes.
Overman,
Yes.
Merman,
Yes.
Cronister,
Yes.
Castor,
Yes.
Ross,
Yes.
Lott,
Yes.
Snively.
Yes.
Motion carried 8-0.
Thank you. Mayor Ross, you recognize.
Thank you, Commissioner. I'll be quick. I know we're all tired. And I don't see Dean Eisenberg or Leona Lopez all, but maybe Mr. Merrill could get the word. I just want to suggest to the group that this has changed. The flavor of this has changed. And right now, the biggest outbreak, as we've heard for hours now, is in the younger population. And I think it would be smart of us to have Leona and our PIOs and the JIC maybe get Dean Eisenberg and come. I think our message needs to be changed somewhat. And there's some organizations like Mothers Against Drunk Driving and FDOT that have done a lot of messaging to this same demographic about DUIs and texting while driving. So they already know how to do this. They know how to reach this group. And I think we need some very quick messaging out there about the dangers and the spread of COVID-19 among these people, and reaching them is different than reaching us. And we've done a good job of reaching us, but I think that's a different campaign. So maybe if Mike could get the word to them, or we could work on that. That's all. Thank you guys for their patience. Appreciate it.
Thank you.
Yes, I will do that.
I'm sorry. Sorry,
I will
Mike.
do that.
Go ahead,
I'll do that,
Mike.
yes. No, I was just going to say we'll follow up on that, definitely.
Thank you, Mike. Commissioner Merman, you recognize.
Thank you, Mr. Chair. Are we, like the mayor did in the city, can we make masks available at certain locations so that people could go get them or businesses could go get them for their business? Would that be possible, Mr. Merrill?
Yes, absolutely.
And then we'll announce that through either the Joint Information Committee or through Liana's shop.
Yes.
Okay, I think it's very helpful. I know I have heard from a lot of people that said the mayor did a good job getting the mask out. Thank you.
Ms. Nively, recognized.
Thank you, Chair Miller. And I don't know if Dr. Holt is still on the call or not. I'm looking to see, but I would like to request some information if he's still on the call, and if not, I can put it in an email. But what I would really like to see, based on what the decision was made today about this mandate, is I'd like to see because I don't know that we had the opportunity to hear from other counties and other municipalities who have had this a similar order in place since early April. And I would really like to see if there's any type of correlation with the mask orders that are out there versus those that don't have a mask order in place. And I really was hoping we'd be a little more surgical and that we could see how Mayor Castor's order went before we decided to, blanket the entire county. But at this point now, I think we just, it's a little late. I still like to see the data though. And I hope that we get to see that not just for our county and our zip codes, but also for other places that have done this. That probably should have been a consideration, but at least we can look at it at this point to decide week to week if that's something that we want to continue doing. Thank you.
Okay. I see no further hands. And before I see any further hands, I want to tell everybody to have a good week. We'll see you on Thursday and we'll adjourn. Take care.